Good evening, everybody. My name is John Fitzgerald, District 3 City Councilor, and I am the chair of the Boston City Council Committee on Public Health, Homelessness, and Recovery. Today is September 4th, 2025, and the exact time is 6:01. This hearing is being recorded. I want to note we are not being live streamed, but the entire hearing will be updated to the City Council YouTube page after this for folks that want to re-listen. If you are looking to submit written testimony, please email our Central Staff Liaison, Megan Kavanaugh, at Megan, MEGHAN, Kavanaugh, KAVANAUGH, at boston.gov. That's boston.gov. And it will be made part of the record and available to all councilors. Public testimony will be taken sporadically through this hearing. Individuals will be called on in the order in which they signed up, and they will have 2 minutes to testify. I want to stress that, 2 minutes to testify. So if you have signed up, please understand that we have a lot of people here, and we're going to try and get through everybody because they all have their right to have their voice heard. So please respect those before you and the person behind you in wanting to make their voice heard. If you are interested in testifying in person, please add your name to the sign-up sheet near the entrance of the room. You probably saw it outside the door. Today's hearing is on docket number 1457, a resolution to declare Massachusetts and impacted neighborhoods a public safety and public health emergency and a humanitarian crisis. This matter was sponsored by Councilor Ed Flynn and was referred to the committee on August 6, 2025. Today I am joined by my colleagues in order of arrival, Councilor Ed Flynn, Councilor Erin Murphy, and Councilor Julia Mejia.
And President Louis-Jean.
And Council President Louis-Jean. Sorry, Council President. I now want to just go through some housekeeping. We're going to do open remarks from the councilors that are here. Couple things. If anyone needs to use the bathroom, you will find my Chief of Staff, Amanda. She'll be out by the door. She's wearing all black. She has the key to the bathroom, and so just find her if you need to go. We are following council rules here today. The council rules are hung up at each door, but also basically we have to act as if we were in the council chambers. That means no cheering, no booing, no clapping. We are letting the council do its work in the community, and when folks have a chance to testify, that will be their opportunity to speak. We want to thank Central Staff for setting this up. Again, I apologize about the size of the room. This was the best we could get in the area. There are not a lot of options, and all the other hotels had similar size rooms, but they were already booked up. Hampton Inn, we thank you. They were nice enough to allow us to use this room. I just want to set expectations for everyone on what will come out of this hearing, okay? What's going to come out of this hearing, what I'd like to do is there are a lot of new faces in the room. There's been a lot of new folks that have reached out to me as the District City Council around Massachusetts, as well as the surrounding neighborhoods and our at-large council members. And what I'd like to do is I want to level set and do a baseline education here of what is currently going on, and I think that's what you will see in our first panel with the administration, to just talk about what is currently being done and how that is affected, and maybe some of the things that the questions you guys might have up front, maybe hopefully we can cut those out by getting it answered by the panel here. And then we want to give the community a chance to speak. There's a lot of frustrated people about this issue, and not just in the South End, but across the city. And so we will have other hearings. I've filed a hearing around a regional approach to this. So what I want to do here is level set, let people vent their frustrations, provide some possible solutions, and then we as a council and as an administration can go back and sort of respond to them. And then in a future hearing, we'll have a hearing around potential solutions and how we respond to what we hear tonight. So there is an order to these things, and so I just want folks to understand that we're not solving the issue tonight, right? But I want to hear from you all, and we want to understand what is currently happening. With that, that will be I'll leave that as my opening remark. Again, I am the district councilor for Massachusetts. I probably have met a lot of you, or have at least gotten emails and been reached out to you guys. We wanted to have this hearing when we did because we reached out to community and they said, John, we do not want to wait. We want to have it now. And so that is why we're doing it, listening to the people, right? And that's what this job is all about, and that's what government's all about. So we want to do that now so we can find solutions as soon as possible. And we will try and speak up for those in the back. And again, I apologize. This is going to be something we're going to have to deal with. Let's just please let the meeting continue, and we'll get through and educate it as much as we can. And again, this will be updated on YouTube, so you can go back and listen to everything afterwards. I will now turn it over to the sponsor of the bill, Councilor Ed Flynn, for his opening remarks.
Thank you, Mr. Chair. And thank you to City Council Central staff for being here. Thank you to City Council Central staff as well for the important work you are doing, bringing us here tonight. I also want to recognize some elected officials that... I also want to recognize some elected officials that are also here. Senator Nick Collins, Representative John Moran from the South End as well. I know representatives from Mayor Wu's office is here, and other elected officials, former City Councilor Frank Baker. What I came to do tonight is really to listen to residents. I think residents know what my opinion is about mass and caste. This is an issue I've worked on for the last, not just 8 years, 16 years. I was a probation officer at Superior Court and supervised the homeless community. I know this area as well as anyone, but what is really happening here is a crisis. I think we all can agree on that. That's the resolution is simple, but what is difficult is how we move forward. But one thing we can't tolerate is open drug dealing and open drug use. That has to be the bottom line, that we just can't tolerate open drug dealing and open drug use in any type of criminal activity. The people of the South End and Roxbury and Dorchester and South Boston, they're very compassionate people. We all support people getting into recovery, into detox, into programs. But we also want to make sure residents are treated with respect and dignity. And they're not. Residents, in my opinion, are living in fear. I met with residents tonight out in front of Mike's Diner, and we all agreed to walk down here and listening to residents talk about their experiences. One woman was telling me that she called the police today. Someone was dealing drugs in her backyard. That was just several hours ago. Another person was telling me there was a scarf folding up and someone was sleeping there. These are quality of life issues. And it's our job as city councilors to represent you, to hear from you. The solutions to this crisis you're not going to find the solutions at City Hall. We're going to find them in this room for residents. You have better recommendations on how to solve this crisis than we do. I'm going to stop here because I want to save time for residents. I know other people want to testify. I'll be here till midnight if anyone wants to talk to me. I'm not going anywhere. I'll listen to every single person that wants to talk to me after, because that's our job as city councilors, and you deserve respect. And hopefully today, this is the beginning of the process to get some respect from City Hall. Thank you.
Thank you.
I'll remind folks, just try and please refrain from clapping. And again, a reminder, make sure the aisles and doors are clear best you can. The aisles and doors are clear best you can. I have to say that.
John, can I just say, is there anyone
Nope.
that's needed
Nope.
to share
Guys,
that needs to
still Reagan, please. This is an official business, and I don't want you to embarrass yourself right now. Please.
I don't want anyone that's standing.
Stop. I will take care of that now. So, Councilor Murphy, your opening remark, please.
Thank you. Thank you, Councilor Fitzgerald and your team for making sure this hearing happened. Thank you to Councilor Flynn for filing the resolution back last month on the council floor. I was ready to support it. It was blocked, which means it was sent to committee. So that's why normally we don't have hearings on resolutions, but because there wasn't a vote on the council floor that day, it bumped it to a committee, and instead of it dying in committee, because unfortunately many things do die in committee at City Hall, Councilor Fitzgerald really pushed to make sure that we were here, so thank you for that. I don't want to waste time, but make sure everyone knows I appreciate central staff and the administration and everyone who is here. to make sure this hearing happens. I do want to say, as an at-large city councilor and representing all of the neighborhoods across the city, the South End, Dorchester, where I live, Roxbury, Andrew Square, South Boston, downtown, you deserve the same thing everyone else deserves. And that's what I feel, and I've been seeing it get worse over this last, say, 6 months, a year, where you don't feel like you're being heard and your quality of life is not what it should be. So a resolution, although all of our resolutions are non-binding, they do send a message. It says, where do we stand? Is there political will? And I believe, we don't have everyone here. I wish there were 12 councilors with us here tonight. Maybe they'll be here. I do need to step out for a little bit, and I will be back till the end for all. But it's important that we're here. It's important that we continue to listen to you. And many people, I'm going to make an assumption that maybe when you testify, you're going to say this isn't the first time you've expressed your concerns. You've been saying it for years. Somebody who is in recovery myself, and 11 years ago, I've shared this story before. I do just want to kind of level set. I'm going to continue to talk. That's fine. But you can hear me. I'll continue. There's no, no, it's
So,
fine.
to the folks in the back, folks that are chanting out back, one thing, hey, folks, one thing out back. They probably can't
That's
hear.
fine. I'll use my teacher voice. I'll make sure everyone can hear me, because we're going to have to continue. Nothing's going to stop us to be here. But 11 years ago, when the bridge closed down, my son was in a bed on Long Island. So I knew then, and I've been at Mass and Cass since then, seeing what happened back then in 2014 and seeing what it looks like today. I know a couple years ago, when I was the chair of public health and just a counselor, filed a resolution to declare an emergency, a public health emergency at Mass and Cass. It was shot down. It didn't pass then. So thank you, Councilor Flynn, for bringing it back up. I think it's important that we listen to the people, that we don't say we're a city who can't be compassionate, who can't give support to those who are struggling. We can. We can help those who are ready for recovery, who want recovery, who may need support, nudging them into recovery, but we cannot do that at the expense of the businesses and the residents who live here. We can figure out a way to do both. We have to, and if we don't, we're failing our residents across the city, not just those who are directly affected. So I'll pass it off to the next counselor, but I do just want to apologize. I had an appointment I could not cancel, but I will be coming right back, and my team is here. So thank you, everyone, for being here.
Thank you.
Thank you, Council Murphy. Council Mejia.
Yes. Can everyone hear me? Yes. That's right. I am so grateful to my colleague for creating space right where all of the action is happening, so that folks who have not been able to experience it could see what it looks like to live and or work in this area. And I think that for those folks who don't represent the district, this is a really great opportunity for other district councilors to understand that we are a city of a whole. There are 13 city councilors, and whether you represent this district or not, whatever's happening here also impacts the city as a whole. And so it's really important for us to be in community. We hosted a hearing around Blue Hill Lab, and we did it in Mattapan. So I really am grateful that we're doing this hearing in this community, because it really gives us an opportunity to experience what it is that you all have been talking about since I've been on the Boston City Council. So I'll just give you a quick little overview. Sue, I just want to thank you, because when I first started my job as a city councilor 5 years ago, this situation was at its peak. You took me on a tour, and things have just gone downhill since, right? It's been a series of fits and starts and Band-Aids, and we have a lot of work to do to get to where we need to be, and I'm a partner in that work. So I just want to thank you for your leadership and everything that you've done in Newmarket to really bring attention to the issues around the businesses. And I also want to acknowledge, right, that this conversation, for me, it's personal. I lost a cousin to overdose, and I have a niece right now that's locked up because of this situation, right? So I am not far removed from this conversation, so I'm able to understand it from both sides. And that's why it's important for us to understand that when you all are showing up, right, you pay for our salaries. At the end of the day, we respond to your needs, not vice versa. And that's why it's so important for us to utilize this opportunity to not just listen for the sake of listening, because we've had these hearings, Sue. We've been here before. We've done this. We've been doing this now for the past 5 years. But who I don't see in this room, and I'm hoping that as we continue to talk about solutions, is that I'd love to see the Attorney General here. I think that we have an opportunity to really get at the root cause. Where are the doctors that are prescribing opioids? We need to really start thinking about outside of this, and we also need to demonstrate that at the end of the day, Boston cannot be the only one who's gonna bear the brunt of how we're gonna solve this solution, right? So we need to also make sure that we're holding our city, state, and even federal electeds accountable to this conversation if we're really gonna get it right, right? And I think that that is what the problem is that everyone, right, for the most part, believes that we here are the end-all and be-all of the solution, and it is not the case. And I think that we have to level set in terms of how we're going to address this issue, making sure that we're holding every single level of government accountable, including the hospitals and the doctors who are also at the root cause of this harm. All right, so I think that as we continue to move through, I am already sounding the alarm of those folks who I want to see in the second iteration of this hearing, because they have a voice and an opportunity to speak. I don't see Nivia Pina or Hector Pina, who are the owners of Doña Habana. They have been blowing up my phone, y'all, seriously, about the money that they're losing. And I also think, and I'm not sure if they are invited to this hearing, but as we're talking about mass and cast, we also need to make sure that we have economic opportunity and inclusion as part of the conversation, because a lot of our businesses are losing dollars every day. And so they are also part of the conversation. And so I'm hoping that in the next iteration of this that we invite them. But again, oh, and I will say to Councilor Flynn's point, I'm a single mom. I will not be here until midnight. My daughter has to be at school at 7 o'clock in the morning. So y'all will forgive me when I leave, and y'all will not judge me because of it. So I'm just putting you all on notice that when I leave is that I am I am the mother and the father in my household, okay? So no judgments. Thank you.
Councilman, thank you for grounding us as always. Council President Lujan.
Good evening, everyone. Thank you to everyone for being here, to all the community leaders from across the city. We know that this is an issue that affects the South End, but there are people here from downtown. There are people here from South Boston. There are people here from Roxbury. This is a public health crisis. This is a public safety crisis, and we need a recovery campus in Boston. We need to make sure that we are providing people with beds, long-term beds for recovery. And I want to thank Kelly and her team and the CRT team, because everyone can say that we need more treatment beds. It's easier said than done, getting people to want to go to treatment and to take that up. I've been looking at some of the legal issues. I've been working with Bob and a crew of people. We have parks that our kids aren't using in Roxbury, like Ramsey Park, that my team has dedicated a lot of time and effort to clean up and have a lot of targeted resources so that the community center there can make use of the park. We have a lot of things going wrong. I do want to thank a lot of my colleagues for their advocacy. I'm sitting right in front of me is the only elected official who actually lives in the South End, John Moran, for, this is also very personal for you, not just as an elected official, but what you experience. Many of us, myself, a few months ago, spent time roaming, had to cancel all of my meetings looking for a friend who struggles with this issue. So this is personal for a lot of us as we try to solve a really complicated and complex issue. It's dehumanizing for the folks who are out there, and it's dehumanizing for the residents, for folks who have to open their door and not know if you're gonna see a needle or defecation or person. It's a quality of life issue, and it's an issue that affects so many of our residents and so many of our neighborhoods, and it requires a lot of intentionality and a lot of resources. So I understand deeply the frustration of the residents. I understand the frustration and the sadness of the parents who have lost their children to corporate greed and pharmaceutical greed that has resulted in this opioid crisis. And I want to thank all of the people in the administration, all of the people who are working together to solve this really complex problem. And I look forward to hearing from all of you and to hearing some ideas that you may have. Thank you.
Thank you, Council President. Council Santana.
Great. Thank you, Mr. Chair, and good evening, everyone. So happy to, good to be here with you all. I'm glad to see that there's a packed room. And this is just a testament of all the years of so many advocates, so many community members, so many residents who have been shouting at the city to solve this issue, right? As many of you know, my number one priority has been our young ones, our youth, and trying to represent the next generation. And as Council President said, you know, it's heartening that there are parks, there are areas in our communities that our families and that our youth can't use because of the crisis that we're seeing here in the city of Boston. I think many of my colleagues said this is just not a city issue, not just a state issue, but a national issue, right? And you know, just want to be here. You know, really appreciate Councilor Fitzgerald for doing this in this district. I've been in close communication with him and his office as Chair of Public Safety on the things that we can be doing, and trying to just meet with as many residents. Again, I know Sue got a shout out. You know, just meeting with as many residents and many organizations who are doing the work every single day. My office and my team and myself, we've done multiple walkthroughs with Kelly's team on the ground, and just trying to see, again, you know, what resources. There's a lot of resources, but there's still an issue. And what I'm focused on is making sure that our families, that our residents can enjoy their neighborhood. And this is not just a South End problem. This is a Roxbury problem, a South Boston problem, right? It's a citywide problem. And I'm just here to not just listen, because I think we all know the issue, but really try to be creative about some and intentional and forceful in areas that we need to be to make sure that we solve this issue. So just happy to be here. I really appreciate Councilor Fitzgerald again for doing this in this district, and appreciate the packed room that we have here tonight.
Thank you, Councilor Santana. I think another good thing to recognize here is when it comes to this issue, we are all on the same team, right? No one wants the issue to persist. So I do appreciate, and I will say thank you in advance to all the folks here for keeping their cool in a hot room when there's a lot of emotion and pressure, but everyone behaving and being respectful and having common courtesy. So thank you all for showing what the South End and Boston is all about in doing that. With that, I do want to get to public testimony, and then we will hear from our panel of the administration. But I want to take these public testimonies again in chunks, like we talked about. I am going to start with some elected officials that are in the room and would like to testify, and then we're going to keep going right into some folks, and then we will get to the administration, just so you guys know when you're up as well. And I think we're going to learn a lot from the administration. But with that, I would call up Representative John Moran. John, please go ahead and take the mic here in the middle. And for folks, when I do call your name up, please come down to the middle here. There was a microphone standing up. That's why we asked for the rooms and doors, the aisles and doors to be clear. Thank you so much. Representative Moran, you have the floor.
Great. I guess we'll test the mic first here. Is it working okay?
You're good. You're good.
All right. Thank you, Counselor and esteemed panel. Really appreciate the opportunity, and thank you for taking me out of order. I want to just acknowledge that my husband and I have lived in the South End for 26 years, and we basically owe a lot to this community, including the fact that we're able to participate in a lot of great events, we're able to do a lot of shopping, support the local, vibrant community that we're in. As the only elected official on any level who calls the South End home, the spillover from Mass and Cass strikes a raw nerve every single day. My State House district covers the majority of the Mass and Cass area, including the Copley Square area, up to Nubian Square, to Orchard Gardens, to Andrew Square in South Boston. If a child steps on a needle or is endangered in Peters, Ringgold, Titus Sparrow, O'Day, Ramsey, or Clifford Park, or in front of the Polish American Center in Dorchester, I feel a deep sense of responsibility. I'm fighting alongside neighborhood leaders and my colleagues in service every single day to manage the situation. Yet, especially in the South End and Lower Roxbury, residents have made it very, very clear that the current approach is not working and we need more responsiveness. This is not a blame game, but it is us sending a clear message that the current approach is not working. It's a call to calibrate our efforts to meet the moment and to openly work together every day using our individual talents for the greater good. I'm really proud of the partnerships I've built with my fellow elected representatives and the amazing Kelly Young of the Mayor's Coordinated Response Team. We have a winning team despite the obstacles we face. But I can no longer look myself in the mirror if I run into a constituent on the street, like I did this week, who has young 2 kids, and they're moving out of the South End because they no longer feel safe. Now, I'm sure some of you are wondering how a state rep can help with this situation. As a legislator, the biggest value I can add is to solve this crisis, to work with my state partners to make sure that the Commonwealth's resources are positioned to manage this situation. So I've worked with the state police, the MBTA police, and the Department of Public Health and DCR to immediately help the situation in hotspots. I've worked to build an understanding of how the state spends its money through the Bureau of Substance Addiction Service, or BSAS, and brought extra dollars for the Southwest Corridor along with Senator Collins. I've made sure that the governor's team is updated, and I'm raising my voice on the Mental Health and Substance Use Committee and talking to the AG's office to make sure we're headed in the right direction on policy issues. I'm using the problem-solving skills that I've gained in corporations as a co-chair of the working group to make sure we're solving the real gaps in the areas of recovery, public safety, and justice reform. I'm solution-driven and not afraid to stick up for my constituents. To give you some examples, recently I supported Recovery Boston back in '23. I worked closely with neighborhood leaders to stop the attempted expansion of services deeper in the South End here on Albany Street, which would have resulted in more centralized services. I secured funding. The mayor asked me to secure funding for the Envision Hotel in JP, and I did that, and that serves as a key relief valve for Mass and Cass. And most recently, I used every means I could to secure the promised bike patrols in D4. I even called Councilor Louis Jean, who did a great job of advocating on that issue. And now we have, thanks to a lot of great partners, we have D4 bike patrols, dedicated bike patrols. And obviously, our office answers a ton of calls, and please continue to call because I want to be your advocate, not only in the city, but on Beacon Hill as well. So to sum it up, today I stand with my neighbors in saying enough is enough, and more action needs to happen right now. Thank you very much.
Thank you, Representative. Senator Nick Collins. Is Senator Collins here?
Yeah, he's here.
Great. Senator, come up. There you go. No, everyone's supposed to have about 2 minutes. Yep. How are you, Rob? Thank you. Maybe you can help him. I don't know. Come on, Nick. Let's go. All right. Thank you, sir. How are you? Good. Please take it. Senator Collins, you have the floor. Yep. You just face whatever.
All right, so.
Speak into the microphone directly, though.
Yeah, I get you. All right, folks, I know everyone's been patient here, and it's very hot.
You got to speak right into it, Nick.
Can you hear me now? Can you hear me now? All right, I want to thank Councilor Flynn for filing this resolution and for the council for having this hearing. It's very important. We've been dealing with these issues for a long time. I want to edify Sure, yep. I want to edify the crowd, but also the council on a little bit of the state sanitary code. And under the Massachusetts Select Board Handbook by the Mass Municipal Association, it says the following. Boards of health have considerable authority to take action in the removal of nuisances. A health nuisance is defined by law as a source of filth or a cause of sickness. Boards of health are authorized to examine all nuisances that may be injurious to the public and to destroy, remove, or prevent them. Separate law gives the select board and the city councils the same tools. I have copies of those for the members. But just a bit of context. I know there's been some concern and confusion around what an emergency declaration can do. It also allows the Public Health Commission and the city to take action immediately on the utilization of facilities, even facilities that aren't owned by the public, to make this accommodation. I know questions around state funding have come up. $200 million plus last several years towards this issue of substance abuse and recovery. There's plenty of funding. But if there's a dramatic need like we have now, and some of the statistics I just want to point out, I think there's a correlation here. over 15,000 overdoses in the streets of Boston since 2020 that we have had EMS respond to, have saved someone's life, and then were discharged beyond that without treatment. These are the same people that are in our streets now that are at risk and causing harm. I hate it. Involuntary petitions have dropped dramatically in that period of time, where we continue to see repeat incidents. These are statistics by the Department of Public Health and this by the Massachusetts Trial Court. Resources that are available. We have the Opioid Recovery and Remediation Advisory Council. That's in addition to the funds that the city gets for the opioid abuse cases, the Sackler family, et cetera. That if an emergency request for funding is made, the state's going to step up. We also have increased funding this year for what's considered the jail diversion program that provides resources for social workers to support public health and safety responses. I think that we should be making a policy change, though there hasn't been many since the last several years, where if somebody overdoses and we send the government to save them, we don't just let them walk away, which happens sometimes, but even more so if we do that and we don't have a policy at our hospitals where discharge only happens after an evaluation is done by a social worker, then people are going to continue to get sent out to the street with hospital slippers on and creating chaos without intervention. And so making a major change, people have talked about co-responses for years. Co-response can be done. And here's the thing about the declaration. It allows the city to marshal the employees to do things that are outside their job description, that require immediate action and holistic action. We saw that during the pandemic. And so those are really important tools to have. Otherwise, that can't necessarily happen. And so we wanted to provide this to the city council. I support this declaration. Thank you.
Thank you, Senator Collins. Representative Tyler? Yep. Thank you, sir.
Good evening, everyone. Thank you so much, Chair Fitzgerald, Vice Chair Flynn, Councilor Mejia, Councilor Lujan, Councilor Santana for showing up today. We really appreciate you offering this this important hearing, and I'll just address the crowd because I'm not used to standing this way. We're used to standing that way, but I'll turn my back to you, no disrespect. So again, I'm incredibly grateful to be here today on such an important topic. You guys know it, we all know it as mass incasts. For those that don't know me, I feel like I know most folks in the room, but for those that don't know, I'm State Representative China Tyler, and I have the honor of representing the 7th Suffolk District at the State House on Beacon Hill, and it is the home of Nubian Square, for those that don't know. I am grateful to be here today, but I'm here today with a very heavy heart because my district is worse than it's ever been in the history of its inception, and more importantly, certainly worse than the crack epidemic that we experienced in the 80s. So again, I have the pleasure of representing Nubian Square, the best economic hub after downtown Crossing. And right now, again, Nubian Square is in the worst shape that it's ever been. In fact, I live in Nubian Square, and I just drove here, and I saw for the first time they set up an encampment down the street from my home. So that was very disappointing to see. So in general, in Nubian Square, we have General Gordon Park, which we just recently built to honor Black veterans. And General Gordon Park is experiencing negative impacts of mass incasts, and our community can't go there to honor Black veterans because it's infested with drugs and violence. As leaders, we can't sit wayside on this issue, and we got to fight back, and that's exactly the attitude that myself and many other electeds took on when it comes to addressing this domino effect issue as it relates to Nubian Square. Recently, when I first came into office, we took on that attitude and we did a walkthrough with some community leaders. And some things that we recognized were two major things. We did a walkthrough of kind of just the Nubian Square area in and around, just kind of walking through and looking for some common themes. And two underlying themes that we noticed were that the smell of urine was outrageous in Nubian Square. And secondly, we noticed is that businesses were dealing with so much negativity and many of them decided to permanently close their doors because they just didn't want to deal with the issues and the lack of funds that they were getting as it relates to their business and just keeping afloat. So I'm going to go a little bit over that, so I just want to just share with that. Thank you. So we did a small solution, and we pushed the city to make sure that the restroom that's located in Nubian Square Station was actually operable. It wasn't for a very long time, and so that, in addition to making sure that they actually clean Nubian Station more than once a day, which is what the protocol was at the time, now it's up to 3 times a day to alleviate the issues just with the public health sanitation issues in Nubian Square. Mass and cast issue, just generally speaking, continued to simply grow out of control. That was my second term in office, and Nubian Square did too. In fact, it grew into more economic hubs throughout the city of Boston, which we noticed in Grove Hall, spreading out to Brigham Circle, and so on and so forth. And so during that time, we wanted to try to push the security issue, making sure that folks were safe in and around Nubian Square and the other economic hubs. And so we have the pleasure of spending responsible taxpayers' dollars every year, and we pushed upwards to $250,000 earmark to make sure that we had 24/7 security in Nubian Square. And while we would love to have had police detail, to be honest, the Boston Police Department, they're stretched thin. They just don't have the resources to be able to do so. But that initiative, when it came to 24/7 security in Nubian Square, in partnership with our Main Streets and Nubian Square Foundation and a couple others, was extremely successful. And so we look forward to continuing to figure out how we can, again, not criminalize the behavior that's going on, but try to just manage it and do something about it. So just moving forward, a little bit more about Nubian Square, I know, but just give me one more minute.
Guys.
I'll close out. So just in closing, one, I'm glad that this issue is being approached by a public health perspective, because again, it doesn't need to be addressed in a negative, or it doesn't need to be addressed in a negative manner, and a public health approach is the best approach to be able to do this. And so we probably need to have this meeting again, or probably have it. I'll come down on the council when you guys have it on a more bigger forum, but I look forward to continuing to work with you guys, and thank you so much.
Thank you, Representative. Much appreciated. Up next, we have folks from the Hampden County Sheriff Office. Could I have Jeffrey Sweetman and Melissa Hughes come down together? Great. If you guys want to come up. We're actually done with elected officials. That was all. We're going to get there, folks. Trust me. It's going to be a long night. We're going to get there. Get as fast as you can. That's all. Thank you. Yeah, sorry.
Good evening. My name is Jeff Sweetman. I'm from the Stony Brook Stabilization and Treatment Center in Hampden County. The humanitarian crisis occurring on Mass and Cass is a public health emergency. The debate isn't about recovery first versus harm reduction approach. It's doing both. Section 35 process is an opportunity to meet the needs of these individuals who are living with substance use disorder. Section 35 refers to Mass General Law 123, Section 35, which allows for the involuntary commitment of individuals with a substance use disorder who pose a serious risk of harm to themselves or others. Qualified persons defined as a police officer, physician, spouse, blood relative, guardian, or court official can petition any district court for commitment. Once the petition is submitted, the individual has the opportunity to participate in a clinical interview, speak with an attorney. The petition and the clinician's report are presented to the judge during the hearing to determine if a civil commitment is appropriate. The Stony Brook Stabilization and Treatment Center is a standalone treatment facility under the umbrella of the Hampden County Sheriff's Office, but completely separate from a carceral setting. We are approved by the Department of Public Health for 152 beds. We are intended to serve the geographic area from Worcester through the Berkshires. However, we provide opportunity for individuals living with substance use disorder anywhere in the Commonwealth, for these people to receive the compassionate care they deserve while also addressing the quality of life concerns for all residents on and around the Mass and Cass area. Since 2021, 10% of the individuals we've served have been from the eastern part of Massachusetts. As of today, throughout the state of Massachusetts, there are over 110 Section 35 beds available. Our program director, Melissa Hughes, will now share more about the treatment that occurs to a person who is civilly committed to Stony Brook.
Hi everyone, I'm Melissa Hughes, the program director at Stony Brook. At Stony Brook, we provide 2 levels of treatment: acute treatment services, which was formerly known as detox, as well as clinical stabilization services. We have 24/7 medical care to include a physical exam for everyone within the first 24 hours of admission and all FDA-approved forms of medication-assisted treatment. We provide daily mental health services, beginning with an evaluation during the first 72 hours of admission, and including a referral to a medication clinic when appropriate. We provide intensive individual and group substance use treatment and family services to support reunification and strengthen family bonds. We believe recovery is self-directed, and therefore, we offer up to 10 groups a day, 7 days a week, on a variety of topics supporting all pathways of recovery. Each client is assigned a substance use counselor whom they meet with to develop a treatment plan for weekly individual counseling sessions and to cultivate a comprehensive discharge plan to transition back into the community with support. Upon admission, approximately 50% of our clients report homelessness. However, upon discharge, only 7% are discharging to a shelter environment. A shelter is always the last option, as we know safe, stable home plans are essential and lay the foundation for continued treatment and recovery in the community. We assist individuals with securing home plans with family or friends who are supportive of their recovery and make referrals to residential treatment programs and sober homes. We also make referrals to residential treatment programs and sober homes.
Guys, folks,
So
we will ask.
if you let me,
Sir,
if you
sir,
give me a second, I can get to why
sir,
we're here.
no. Hey, sir, this is a warning. This is a warning. No, it's a warning for the folks to abide by the time, and I will make sure that they cut them off. But this is also a warning for everyone else about outbursts. If we have to do this, folks understand we will have to clear the entire room and then enter back in. We do not want to have to go through that. That will throw off, that takes away from time of people testifying. So please mind the outbursts. Thank you. Please finish up. Thank you very much.
So what we have at Stony Brook is an opportunity to support you all because we have beds available and we stand ready to be a resource for Boston to help address the mass and caste crisis and to provide compassionate recovery care and intensive discharge planning so people don't end up right back where they started. That's what Stony Brook has to offer, and that's what our Sheriff, Nicholas Kochi, is committed to providing. Thank you.
Thank you so much. Please refrain. Nivea Pina from the Donna Habanya restaurant. Nivea? Could you ask if if folks at the door could maybe even ask if Nivea Pina from Donna Habanya restaurant is here? And just so folks are aware, after that, we'll do Avril Carmine and Diane Wilkerson, okay? Nivea Pina, Avril Carmine, and Diane Wilkerson are the next three up. Nivea, yep. Please come out. You just come around the front here. Thank you so much. And if folks are waiting, you can always grab a bite next door. You just talk to the crowd. That's fine. Doesn't matter.
No, I want to talk to you.
Yep, fine.
Because my story is their story as well. I own with my husband, Doña Havana, which is the restaurant that is right out of here. I'm very nervous, sorry. I'm going to speak from my heart. I'm going to lose my restaurant just because the situation here. I had a very hard meeting last week. The situation has gotten so bad that not only the safety, the moral, everything. I have even depleted my 401k to keep the restaurant open. I have invested everything here and nothing happened. It's been 9 years. I'm so.
Take your time.
It's hard because we've been in the city for 30 years. We own Merengue Express, Vejigantes. This one will be 9 years, actually, was 9 years last week. We recently opened in Worcester, but this one, just from being our number one, is our worst now. To make numbers, we're putting a week $5,000 out of our pocket just to pay payroll. I don't have any more money. And I don't have to tell anyone how to do their job. I work as also, and I haven't spoken to my boss, I think, in 4 years, just because I know what I have to do. I do my job. I do it very well. That's why I have no complaints. And I do, and I'm always where I'm supposed to be. I don't have to tell anyone why we're doing good, call 911. The story, it's always the same. And just experience one day out of in my patio and you will understand. They throw syringes at us. They throw whatever they want. They use the barriers as ladders to go inside our property, destroy our property. Nobody pays for that. And we're not asking for money. We're not asking for anything. We're just asking for the city to think out of the box and stop these meetings, because it's I don't know how many more years we're gonna go through this, but it's meeting over meetings of nothing. And I'm just frustrated, I'm sad. I have to break this to my kids, and I don't know how. I just had a meeting with my staff. We cut their hours because what can I do? And I'm sure many more people are gonna say the story. This is just a gist of what it is. And you guys have to literally go out of your office and understand this. I'm glad that you guys are coming here, but I think it's already too late. The damage is done. The people literally make a reservation, they drive by, and I'm sorry, I cannot go in. Last Saturday, I had a person literally in front of our door for 2 hours because the guy could not stand. The people from the hotel lost their inspection, like we go through every year, the Hilton does an inspection, they didn't pass. You know what that means? If the hotel loses the flag, they gotta go out of business. I'm gonna go out of business. Obviously, I'm gonna go out of business. And Dunkin' Donuts is also leaving. So you are at the entrance of Boston. And this is the scene that everybody sees every day. When they come and they make a reservation at the hotel, you know what they do? They cancel from the outside. Or they stay that night because they don't have any other place to stay. And then they ask for a refund. They lose the money. Not only, and they serve the people for one night, so they have to pay the cleaning room and whatever. And the bad reviews and so on, so on. So I don't know what you guys are gonna do, but we are very, very, very tired. I don't have any more strength to fight. That's basically how it is. And I'm sorry, thank you for listening. I wanted to speak to you because you are here because we voted for you guys. We pay your salaries. Yep. You have to do something for us because we invest in the city. We have people working, maybe 40 people, but 40 people represent a family of 4. So that's the thing. And it's very nice to be in a suit in an office. I want to do that too, but I can't. I have to come here because I had to fire my hostess and a waiter to come and wait, sit people on a table just to save $100 on a night. That's it. I don't want to say anymore, but thank you and have a good day.
Nivea, thank you. Thank you for all you do. Avril? Thank you.
I'll try to be quick. My mind goes everywhere, so you don't know what may come out of it. But I am feeling all of you. I am feeling the energy, the frustrations, because I am you too. Thank you, Ed Flynn. Seriously, I know you're going to get, and all the other counselors, you're going to feel a lot of the frustrations. It's going to come onto you. But our mayor spent $12 million to disassemble Mass and Cass? And look where we are. We're worse than where we were. That's not right. And it comes down to our Mayor Wu. So you can't just put all your frustrations onto our counselors. I get it. They're the ones that are here in the room that you can actually look at, talk to, let the frustration out. But I want to speak to all of you. Thank you for coming down here. It's a crowd. It's a huge crowd, and you're frustrated, and it's hot in here, and I'm not going to take up too much time because this paper says it all. This is a public safety and public health emergency and humanitarian crisis. Why are we here now? Why has it gotten this bad? Why is she having to shut down her restaurant and other businesses? And why are we cleaning up the needles? Why are we 311ing the needles and they're just coming and picking them up and then moving along until we have to 311 the next needle? So thank you. Come up here, even if you're nervous, because I hate public speaking. Stutter. Forget your words. Just get up here and use your voice. Because we are the citizens. We're neighbors. We're the community. We are Boston. And we won't take this anymore. Thank you.
Thank you, Admiral. Diane, you're up in 2 minutes, please. Thank you.
Good evening, everyone. My name is Diane Wilkerson. I have been a 45-year resident of Roxbury, Dorchester, and Lower Roxbury. If I had a title for my comments tonight, it would be, where do you think they go when you disperse them? And how is that a plan? I want to thank the Counselor Fitzgerald, Counselor Flynn, Counselor Murphy, Counselor Mejia for constantly raising this issue in public. And we all want to be respectful, but you know what? You can't have this conversation without it being political. The reality is that none of this matters if you go into the polls and vote for the very people who blocked us and put us in this room instead of in City Hall. So that first test is on Tuesday. The last time I was in this room, 2 years ago, a friend of mine visited from Cleveland. You'll understand why this is important. I had met with her out in the lobby. I was sitting on this side of the wall. She came and sat at the table. I had her stay here. While we're sitting there having coffee and tea, there's a rustle of activity, and the next thing I know, I see the police come in and go to the elevator. I don't want her to get nervous, so I don't say anything. A few minutes later, I see the coroner bag come in the lobby. And then I see the stretcher. While I sat there with her, someone OD'd in the bathroom. And the next thing I know, the stretcher comes by us. I'm talking to her so she won't look behind her. Someone died while I was here having tea. OD'd in that bathroom. That's why you have to get a key. This is real, people. This is very real. And I want to say this to you, to all of the people. First, this isn't about the South End. This is about Boston. This is about Roxbury. This is about Grove Hall. This is about Nubian Square. This is about Upham's Corner, because that's where they go when they clean them out when company comes. I'm scared to death, and I want you to understand why. Because I know that most of the people in this room can't even appreciate what I'm going to say to you, but you need to hear that. Every time the mayor of this city gets on TV and brags about us being the safest city, she's poking an unhinged bear. And the threat of that is that they are going to send people who are ICE or who look like ICE to this city to snatch up people that look like me. They are not snatching any Asians. They are not snatching any white people. But yet this room is filled of our allies, and I know that. But I want you to understand it's a different kind of reality. A different kind of reality for the parents who sent their kids to school yesterday for the first day and are having to run through, watch, and make sure that they don't step on a needle. What the hell is this? This is not an urban city reality, but it's ours right now, and we can stop this. We can stop this. Share. Right?
Thank you, Diane.
I don't think I'm at my 2 minutes, but I'm going to be respectful of you.
We are at 2
no,
minutes.
I'm at
Diane.
now.
Yes,
I'm there.
absolutely.
So thank you. I'm done.
Thank you.
My point is we're in this together. That's all.
Thank you, Diane.
We're in this together, sir.
Thank you. Great.
And we're only going to fix it if we work together.
Thank you very much.
Got it? Thank you.
Got it.
Thank you.
Thank you, Diane. And Edward, I think it's CZA.
Try Crowley, Fitzy.
Ed, that's you. All right. You have great handwriting, Ed.
Folks, I'm here tonight. My name's Ed Crowley. I'm from Dorchester. I'm here to support you people because the methadone clinic did not go on Hoyt Street in Dorchester, because the methadone mile would have went from Andrews Square to Milton through a residential area. We fought against it, and it was put down on Atkinson Street. I'm sorry for everybody in their pain. It is ridiculous of what's gone on, and everything has failed. And as Diane said, the current mayor made a campaign promise 4 years ago to clean up Mass and Cass. Well, how much bullshit do you want to listen to now for another campaign promise? How much crap do we throw against the wall and hope it sticks? Because it's not. Her new plan about the new offices coming out onto the street is not going to work, folks. 50 offices go into D4, that 50 offices have to train them. 30 hours, 30 tours, I'm not sorry, not hours, 30 tours, equivalent to 6 weeks before these officers go on the street by themselves. So what kind of training are they going to get if they're walking beats on Mass and Cass when all the other neighborhoods around are being affected? Because what it's going to do, it's going to take the resources from the other districts away. And I'm going to go a little deeper, a couple of years old. The media can go fact check me. You go look for the Freedom of Information Act. 2 years ago, the mayor's office reached out to the commissioner's office under Superintendent Long and said, do not arrest on Mass Ave. So what are you supposed to do? You're going to put up with some more nonsense and be told we're going to fix it? It's a campaign year running for re-election. And I'll tell you right now, I'm voting for change. I'm voting for change at the mayor's office. I'm voting for change on the council. And if you people want to see change, I suggest that you vote change. Get out there next week. Get out there in November. Again,
Thank you.
I'm here to support my neighbors in the city because I'm just happy that it didn't come to Dorchester. Thank you.
Thank you, Ed. We're going to have one final person for now, and then we're going to go to the panel, just so as a heads up to you guys. But Elizabeth Taylor from the South End. Elizabeth Taylor. Is she in the room, or is anyone could ask outside if there's an Elizabeth Taylor from the South End? You're up right now. They can hear. They can hear. Yeah. Huh? Guys, thank you. Yep. We'll have, is Elizabeth on her way? No. All right, Randy Lathrop. Is Randy Lathrop here? And after Randy, if Elizabeth can make her way, we'll do Randy, Elizabeth, and then the panel. But if not, then we'll go right after you, Randy. Please be mindful of the time. Thank you.
My name is Randy Growy Lathrop. My husband and I moved to the South End 40 years ago. My son was 6, he's now 46. It is unbelievable. I was neighborhood president, I worked for Mayor Menino for 17 years, and I volunteer every single day in my neighborhood. It breaks my heart on what's going on in the South End. I lost a nephew 4 years ago from substance abuse. Why? Because Mass and Cass. He tried Long Island Shelter, and he tried a bunch of other places, and Mass and Cass killed him. My other nephew survived, And he's finally clean at 55 years old. But 40 of those years, he was addicted to heroin. It strikes home for me. What drives me crazy is when we moved here in 1986, people said, you know what? That area's always been like that. No, it wasn't. We had the L. We had prostitution. We had petty crime. We did not have what's going on today. We lived it. My son works over on Newbury Street, back of the house, at a pizza place. He worked through Boston Public Schools. He's a big guy. He's been chased down Mass Ave. Nothing scares him. He's scared. He's run into like a CVS in broad daylight because of Mass and Cass. He calls me up and, Mom, fix this. This is crazy. He grew up with us. He grew up when I was president of Blackstone Franklin for 10 years. He's like, Mom, what is going on in our city? My husband and I are going to die in the city. But what's going on is not acceptable. It's happening to all of us. I just stepped down as a volunteer on the South End Business Alliance. I was on that as a volunteer for 7 years. I headed up government relations. 2 weeks ago, we had 80 business owners show up with 1 week's notice. Because I live in that neighborhood, everybody calls me and they tell me what's going on. Every single business is having issues in the South End and Lower Roxbury. Every one of them. Just like the woman talked about over here. They don't know what to do. They call me up. I'm down on the Cape. They call me up. I'm taking phone calls 24/7. I take phone calls from 6 o'clock in the morning to midnight because that's who I am. Enough is enough. It has touched every home. Monsignor O'Leary at the Holy Cross Cathedral said to me one day, Randy, every family has issues and every family has crisis. And if they don't, they're lying. And that is true. Every one of us is feeling this. It's time. And thank you to city councilors, Ed Flynn, John Fitzgerald, Aaron Murphy, my state rep, John Moran, and Nick Collins. Thank you so much for fighting for our neighborhood. We moved 6 years ago from Haven Street. It's a little wooden house near Flower Bakery, and we moved to St. Potoph Street.
Thank you, Randy.
But I just got to say one thing.
Yep, go ahead.
They cleared supposedly Newmarket today, which you know didn't happen. We were getting into the car tonight. Right behind my house is the Colonnade. And who is capped there? A guy from Mass and Cass with all his belongings. So what do? Of course, is call 911. It's everywhere. It's called push-pull. Yep. Enough is enough. There is solutions. Long Island Shelter will never happen.
Thank you, Randy.
Shattuck will never happen. It's time to find a solution. Thank you.
Thank you very much. So we will continue taking testimony throughout this, but I think it's important to hear from the administration at this point, and then we'll do a round of quick questioning from the councilors, because I think we do want to hear more, but we'll allow everyone to ask their questions. I'd like to thank Councilor Durkin for arriving as well. Thank you, Councilor. With that, I will turn it over to the administration. I would ask folks to remain quiet, and I think this is where really a lot of the learning will happen at this panel, so I'd ask people to please pay attention. Dr. Odukutu, I will turn it over to you, but of course, why don't we at first allow everyone to introduce themselves? Well, there's only one mic. So, why don't you start, and as we go, please introduce yourself and give your presentation, and then we'll go into questions. Thank you.
Okay, good evening, everyone. Can you hear me?
Speak right into it.
Okay.
Bring it closer, yeah.
Okay, good evening, everyone. Can you hear me? Wow. Okay. All right, my name is Dr. Basolo Jakutu. I am the Commissioner of Public Health for the City of Boston and the Executive Director of the Boston Public Health Commission. Thank you, Chairman Fitzgerald and the other city councilors for convening this meeting this evening. So the City of Boston has set a goal to end congregate outdoor drug use and to address the serious impacts caused by substance use disorder in our city. The Boston Public Health Commission is committed to these goals and has been working alongside CRT, BPD, provider partners, and the state to address these critical issues. Some progress has been made. We place hundreds of people who previously slept in a large encampment in low-threshold spaces. More than 300 of those individuals have moved onward to permanent supportive housing. But I recognize that progress has not been felt by many, and that many residents are still experiencing serious quality of life and safety issues. This is completely unacceptable. As the city's public health department, the Boston Public Health Commission has always employed strategies to increase access to substance use treatment, reduce overdose mortality, and decrease the harms of drug use. This is part of our core work as a public health agency. Since January, we've also made significant changes to our work to address the serious quality of life concerns and support the city's goal of ending congregate outdoor drug use. For example, we have expanded treatment access. We now have our PATHS team, these are our treatment navigators, working with our outreach team and providing direct contact to substance use treatment citywide. In the last 6 months, we've made 1,185 referrals to substance use treatment, and we've made 785 transports to treatment services. I think it's also important for you to recognize that we actually have and run a residential treatment program in the Mattapan area, 75 beds. Over the course of the last year, we've housed 1,000 people at that campus. We have also provided transportation and family reunification. In the last 6 months, we've strengthened our efforts in the area. We've reunited 76 homeless individuals with family and friends, and we've also helped 70 people return to their community of origin outside of Boston, either in the state of Massachusetts or in other states. We've also increased needle pickup. The Recovery Services outreach team now operates an additional 6 hours per day from 5 a.m. to midnight, 7 days per week. That's in addition to our mobile sharps team and to other services that we provide to pick up needles. We also continue to fund the New Market bid to support cleaning and syringe pickup, as well as ongoing adjustments to address neighborhood needs. In addition, we've decentralized our services away from Mass and Cass. This year, we placed substance use navigators at 3 community health centers and established public health vending machines in other places in the city, outside of Mass and Cass, outside of the South End, outside of Roxbury. But we're clear that more changes need to occur. I think one of the problems, and I think we all are clear here, that we need a recovery campus. And we've been working with Sue Sullivan and with Steve Fox on the Recover Boston program. We've made recommendations, and we'll continue to work with them as they move towards that goal. We are also co-facilitating a roundtable of providers to do targeted case management, to move people more quickly into treatment. Much of our treatment system is not working for people, so we're doing our best to fill in those gaps, and I think you're going to hear more about that from the other people on the panel. So we're continually reassessing our work and making adjustments. We're here tonight to hear your feedback, and I'm hoping that we can continue to work together. This is not just about public health, though. It's certainly about public safety and all of us in this room. Before I conclude, I want to say a few words about the meaning and significance of a public health emergency, because I think it's important for us all to understand the legal implications. Per Massachusetts state definition, a public health emergency is an occurrence or imminent threat of an illness or public health condition caused by bioterrorism, epidemic or pandemic disease, or an infectious agent or biological toxin that poses a substantial risk to humans by either causing a significant number of human fatalities or permanent or long-term disability. In Boston's history, we have only declared a public health emergency once, and that was during COVID-19. As we've discussed in previous hearings, state law allows boards of health to authorize local health department leaders to issue temporary emergency orders to address threats that meet the definition that I just gave. But declaring a public health emergency does not unlock any additional public authority for resources. We do not get any additional resources. It also does not create sustainable, evidence-based programs or services, which is what we need in this case. What it does do is it suspends important public processes similar to this one and should be reserved for time-limited threats to public health. We appreciate that this resolution was made. We understand how important this is. This is, if not our top priority, it's one of our 2 top priorities. And we want to make sure that you understand that we understand that this is a humanitarian crisis and we feel the urgency. But a public health emergency is not the way to go. It's not going to do anything in this case. Finally, just for this group, I think it's important for us to recognize that it's National Recovery Month, and last week was International Overdose Awareness Day. We should recognize individuals who are in recovery and mourn the lives of those who died to overdose. Here in Boston, we should celebrate the fact that overdose mortality has decreased 38% from 2023 to 2024, and that's largely due to the hard work of many providers, some of whom are here in this room, and many of you all who have paid attention to this crisis and who care. But we have a long way to go to address this crisis. Thank you. We're here to listen, and I look forward to answering your questions.
Thank you. Please, no applauding. Thank you, Dr. Ojikutu. Kelly Young, Executive Director of the CRT.
Hi, everyone. Good evening. My name's Kelly Young, and I have the privilege of serving as the Director of the Coordinated Response Team. I'm a member of the Mayor's Office and was a former member of the Boston Emergency Services Team. I want to start by saying that every day of the week, my team and I are out there. I want to acknowledge that to date, our efforts have not been enough. We are moving the needle, but we will not give up. The Coordinated Response Team works every day to address public safety, public health, and quality of life issues facing our neighborhood residents and businesses citywide. But we are mostly focused on the challenges here in the South End and in Roxbury, and other areas with the impacts of outdoor drug use, which is illegal and unacceptable. In CRT, we work with city departments, particularly the Boston Police, Public Works, EMS, the Public Health Commission, and the Mayor's Office of Housing, along with elected officials, state agencies, community leaders, and our partner organizations. Our ongoing focus is to end outdoor substance use in Boston by treating addiction, targeting drug dealing, and congregation at the core of our public safety and quality of life concerns. Allow me to say what our mayor has also said many times. Outdoor drug use is illegal, and the impacts on the neighborhood are unacceptable. We have not yet succeeded in solving these challenges, but we're working at it every day. In yesterday's memo, we shared some important updates, and I want to mention just a few. First, we are glad to report that because of the new graduating class from the Police Academy, we will have more police officers to deploy to this area. We are also grateful to have a new D4 bike unit on patrol. Thank you, Joe. From March 1st to September 1st, the Coordinated Response Team has connected an average of 55 individuals a week in the South End and Roxbury, transitioning them to ATS, acute treatment services, residential treatment, and transportation to place of origin. CRT has participated with the Boston Police Department in petitioning for 32 individuals to be placed in Section 35 commitments as life-saving measures. CRT, over 6 months, has supported individuals with 297 requests for transportation to places of origin or to allow for family reunification. In July, the city announced a partnership between the Coordinated Response Team and the Gavin Foundation that is up and running, that provides us detox beds and rapid transportation to bolster our diversion program with law enforcement. Since August 15th, Gavin has assisted CRT in the city with 12 individuals with transportation and connection to substance use treatment. My team is now working with other city leaders to convene new weekly hub table, which brings together substance use, housing, healthcare providers, as well as state officials to work through a by name list and connect individuals with substance use treatment and recovery programs. The table is organized with the goal of ending outdoor substance use and transitioning individuals away from the area. I want to thank BPD and the Public Health Commission for co-leading with CRT. I also want to acknowledge the Public Health Commission for their work to expand syringe pickup from 5 a.m. to midnight daily and to reduce hours of distribution to help to address the ongoing challenges with needles. Finally, I want to acknowledge that CRT is part of a 5-person leadership team for a working group on addiction and recovery, alongside Councilor Fitzgerald. That drives initiatives across 3 focus areas, which are recovery, public safety, and judicial initiatives. We are grateful for that partnership and its focus on short and longer-term goals. We are grateful to be in this space, and I look forward to any questions.
Thank you very much, Executive Director Young. I'll turn it over to either Dan Humphreys or Ryan Walsh. Dan Humphreys with Boston Police, and Ryan Walsh, the Director of the Bureau of Regional Intelligence Center. As you wish.
Thank you. So I'll read my opening remarks. These are going to be very broad brushstrokes just to understand what we're doing. And obviously, I'll make it quick so we can get to questions and more public testimony. Because at the end of the day, we're here to listen to what people are saying, all right? And we are going to calibrate, to use the representative's term, to calibrate what we're doing on the ground to address specifically what everybody's talking about here today. So I'm Deputy Superintendent Dan Humphreys. I'm the Assistant Bureau Chief for Field Services for the Boston Police Department. And so who we are, we're the largest bureau in the department, and we represent the uniform branch of the department. So in addition to the district stations throughout the state, the city, we oversee the several support units, like the Street Outreach Unit, our Special Operations Division, our Youth Violence Strike Force, and the Citywide Bicycle Unit. The Bureau coordinates our strategic deployments of these units in the districts, along with officers from other divisions throughout the city, and we work to address complaints and concerns through 311, 911, intelligence, data, as well as community feedback. We work hand in hand with the community response team, as well as the Boston Public Health Commission, and on a daily basis, we work towards removing encampments, connecting vulnerable community members with services. We support the diversion of individuals through the criminal justice system when appropriate as well. But I want to make it clear, we have heard the concerns and frustrations of residents and business owners regarding drug use, drug dealing, congregations, things that are impacting the safety and quality of life in our neighborhoods. We recognize the difficulties that this has caused and are working every day to address these concerns through strategic deployments. As a result of some of the feedback that we've received, year to date, we've increased our arrest numbers in the South End by 83%. So far this year, arrests are up 83% in the South End. We've also increased our directed patrols in those areas. And just recently, we've also doubled the size of the Street Outreach Unit, and we're going to adjust some of the ways that we're interacting on the street, and we're adjusting those deployments based on community feedback. So together with our partners, we're combining continuous enforcement and direct pathways to divert individuals to treatment and away from the area through voluntary access, judicial diversion, compulsory sectioning. And I can assure the counselors and the hearing attendees that the Boston Police Department has and will continue to maintain a proactive and continued presence in the South End and Roxbury and other neighborhoods most impacted by these outdoor drug uses. And we are, to use the representative's word again, currently in the process of calibrating what we're doing, because there are in areas we have seen when we work together as city partners, our private response partners in the community, we do see areas that we do see forward progress, and we want to take that and spread that into other places. So we are committed to working with our city partners and community residents and business owners to deploy our resources to address ongoing public safety and quality of life and public health concerns as the community's needs change in these areas. And we will adapt our response based on your feedback and communication, and I look forward to answering any questions and providing more specifics.
Thank you, Deputy Superintendent. Director Walsh.
Good evening, councilors. Thank you for the opportunity to provide a brief overview of the key metrics that the police department has been using to assess the situation in the Roxbury, South End, and Newmarket areas. My name is Ryan Walsh. I serve as the director of the Boston Regional Intelligence Center within the Bureau of Intelligence and Analysis with the Boston Police Department. I'm going to cover 4 key areas of data that we have that include quality of life calls for service, major crime incidents, arrests, and our directed patrol events. Overall, so far in 2025, major violent crime, including homicides, rape, robbery, and aggravated assaults, has declined 10% compared to the same time period in 2024. Property crimes, including residential and commercial burglary, larceny, and auto thefts, have decreased 4%. Overall major crime incidents in the area have declined 5% in 2025 compared to 2024. While we realize that major crime incidents may be decreasing, There remain significant ongoing quality of life concerns in the area. We measure these based on 911 calls that are coded into specific groups. Overall, quality of life related calls for service have increased 11% in the area this year compared to the first 8 months of 2024. This includes increases in calls for disturbances, fights, large groups, intoxicated persons, and drug investigations. Historically in this area, calls for intoxicated persons, noise complaints, and disturbances have been most prevalent. It's important to note that nearly half of all directed patrols conducted in the area have been targeted to the area with the highest concentration of quality of life calls. We continue to encourage residents to call 911 when they need police assistance. Another indication of the department's ongoing efforts to conduct enforcement in the area is the 39% increase in arrests so far in 2025 compared to the same time period in 2024. A total of 1,057 arrests have been made in the area this year so far, including 467 arrests for drug-related offenses. These drug-related arrests represent an 85% increase over 2024 levels. During May, June, and July, more than 80 drug-related arrests occurred per month in the area. Approximately 16% of the 865 individuals arrested in the area this year have been arrested twice or more this year. Additionally, 76% of individuals arrested this year reported living in Boston at the time of their arrest. During the summer months of June, July, and August, the department has conducted more than 3,000 directed patrols in the area, with officers encouraged to walk around areas of concern and engage with the community. More than 1,500 of those were in the areas with the highest concentration of quality of life concerns. We continue to review this data with our command staff regularly and adjust deployment efforts accordingly, and remain committed to continuing to improve our metrics and analysis in this area. Thank you.
Thank you all. That will conclude the presentation, I imagine, from the administration panel. Thank you all for that. What I'd like to do now, as I know typically to my colleagues, we'll do some more questions for us, but I know that that can take up a length of time. I'd like to take a couple more testimonies before we do get into questions, just to hear more from the people, and then I'll give us all a certain amount of time to go forward. Is there Donald Weber? Donald Weber in the room? If anyone wants to ask out back. No. Don. Sometimes what happens is people think this is just the sign-in sheet for the meeting, and then they don't know it's the sign-in to speak. No, it happens all the time. So I just want to make sure if people sign in. Linda Zablocki. Linda, you have the floor. Thank you.
Good evening, and thank you, everybody. We're all in the same boat with this, but there is nothing happening. We have had meeting upon meeting. We have everybody reading from papers, and I'm talking from my heart. I am disgusted with the way this city has taken care of this problem. Really, nothing has happened. All we've done is cleaned a little bit of mass cast, and it has all dispersed to the neighborhood. So the quality of life has gone downhill faster than a ski slope. It's disgusting. We are all in the same boat. We all need to row in the same direction. We need all of our elected officials, including City Hall, to look at programs that have been presented. 2 years ago, I think it was, that we talked about Recover Boston, correct? And I said it then, and I'm going to say it again. We need to have long-term care. Everybody out there is somebody. No matter how we look at them. Crap in the pants, needle in the arm, they belong to somebody. We cannot just look at it as a problem. It is our problem, but we keep enabling this to continue. We're continuing to the depths because we are not helping these people. As a civilized society, we have an obligation to make decisions for those who cannot do so, and we are failing miserably. This has got to change. We have got to put help out there. There is minimal help. There needs to be long-term care like Recover Boston, or as Senator Collins, a ship that people are taken care of, that they get the STEP programs. You can't do a 30-day spin dry, and then you're out in the streets again. You need to go from station 1 to station 2 until you're in the station where you can now get out to society and not be a threat to yourself and everybody out there. So this is my heart speaking, and I'm hoping that everybody at this table and everybody in this room continues this, but we need some action, not just verbiage. I'm tired of the verbiage. I'm tired of the meetings. I think everybody here would rather be home sitting on their sofa watching TV. Here we are discussing an abnormal situation in the city of Boston because it has been allowed to continue for so long. And Mass and Cass has done nothing but spread through the neighborhoods. So now it's a cancer everywhere instead of in one area.
Thank you, Linda.
Thank you.
Much appreciated. Up next, we'll have, I think we call it together, we'll have Ryan Rogers Hammond and Matthew Hammond, if they want to come up together.
Sorry. My name is Ryan Rogers Hammond. I'm the mother of 2 young children and a resident of Boston living in the South End. As the daughter of a recovering addict, I've lived my life in the long shadow of addiction. My experiences, combined with a PhD in biomedical science, allow me to understand the complexity of the addicted brain and the nonlinear path to recovery. But understanding doesn't protect my children, and neither does the city's current response to the undeniable public safety crises at Mass and Cass, crises that are bleeding into other areas, including my home. On August 10th, while my children were having breakfast, we heard footsteps overhead. Moments later, an unhoused man calmly exited our home. He'd been using a stolen key to come and go late at night and early in the mornings, sleeping among the construction debris and defecating in our living room. I'll say that again, differently. He pooped in my house. We're here to address a public health emergency, and human waste is a very real part of it. It carries harmful pathogens that can cause serious illness, especially in children and elderly, the cornerstones of our community. It's on our sidewalks, in our playgrounds, and in my case, my home. Human feces isn't just disgusting, it's dangerous. When we shared our story, nearly every neighbor had one of their own. Many are here now. Theft, trespassing, open drug use and sales are effectively decriminalized. Meanwhile, counselors, like Counselor Durkin, blocked the resolution to declare this a public safety and humanitarian crisis. Shame on you for that. Where's the line? Do children have to die? What if that man had come downstairs? He had 2 open warrants for violent crimes, a long pointed stick, and a bungee cord. What was that for? I can only speculate, and it's terrifying. We're told bike patrols are coming, but a 2023 study out of Philadelphia found that they didn't reduce crime. I can send the paper if anyone's interested. They actually increased violence shootings and just shifted the problem to other neighborhoods. That's what's happening here now. Addiction is a disease, but when paired with homelessness, untreated mental illness, zero accountability, it becomes a public danger that we all are facing every day. Too much deference is being given to those committing crimes and not those living with the consequences. All of us are here pleading with you to act. Not next week, not for the cameras today, not after the election, now. We can't wait any longer. Thank you for your time.
Thank you, Ryan.
So it's going to be really hard to follow my very well-spoken wife. I want to talk about the failed policies. These failed policies happened on your watch. This mayor's watch. It's happening to our kids. It's happening to our restaurants. What are you doing? What are you doing for us? How are you helping? Like these actions, this 5-page memo I got yesterday, what was that? Like you're trying to gaslight me into thinking you're doing a good job? It's not working. We need something better. We think bigger. Call in the state police. Get people off the streets because they're pooping in my house. And with that, I'll just leave it to my neighbors to continue. Thank you.
Thank you, Matthew. So the next 3, and then we'll go to questions. We have Frank Baker, Emily Schleer, and Tom Downard. Frank Baker, Emily Schleer, and Tom Downard are the next 3 speakers. Please and thank you.
Thank you. I'll be quick. John, Councilor Fitzgerald, thank you for having this. Eddie, thank you for filing. Rest of the council, thank you for being here. We need real solutions here. Going back a couple years ago, we had the ice building at Tompkins Place there. We were going to turn that into a Section 35 programming. We had a satellite courthouse to be able to facilitate those sorts of things. the party has to stop. It's either arrest or Section 35. We've got to get away from the housing first sort of thing. Housing after people are sober for a year. Housing after people are sober for a year. In the South End, Lower Roxbury, Dorchester, everybody's had enough. We need the political will and the political courage to be able to pull these things off, because we also had Kochi here earlier to tell us that he's going to help with the Section 35s also. We're not going to do this. You got to break a couple eggs to make an omelet. We need to break the eggs. Arrest or Section 35. Real treatment is what we need. Thank you. Thank you.
Thank you, Frank. Emily Schlier. Emily? Oh, great. Thank you.
Good evening, counselors. My name is Emily Schlier. I live on Worcester Square. Last month, my home was broken into. A woman who had been arrested for the same exact crime 1 week earlier and was released entered my home, slept in my bed, stole more than $10,000 worth of belongings, and was out of jail again within a week. Last night, we had another attempted break-in. This is what no accountability looks like. Families like mine are paying the price. Every morning, my 4-year-old son has to either step over a person, a needle, or human waste when we leave our front door. That's his daily reality, and I'm not exaggerating. No child in Boston should grow up thinking this is normal. We're being told that it's getting safer, but what I see is an administration trying to redefine what safety means. It's not safe to step on a needle. It's not safe to have someone high on drugs break into your home. This neighborhood is not safe today, no matter what statistics you are showing. What about the ones you're leaving out? We don't need more police standing around telling people to move along. We need police that are empowered to enforce laws. We need laws that are followed and consequences that actually mean something. Otherwise, this is just more theater where all our families suffer the reality. We're all in this room proud of this city, and I think we all want to stay here. But this is exactly what's pushing families out. This isn't just fear. This is a room full of thoughtful, community-minded people, and we pay some of the highest residential taxes in Boston. If we're questioning whether or not to stay, this should be a wake-up call for everyone here. What's more telling is that our neighbors, I'm going to go out on a limb and make it political, most of whom are Democratic, are talking about calling in the National Guard. This should alarm every single one of us. If we're the ones talking about this, it should, and what it takes to restore basic safety, that shouldn't be necessary. But the city is not protecting us, and what other choices do we have? This isn't just a humanitarian crisis. It is a public safety emergency. We need immediate action, treatment that works, housing that's actually safe, and actual accountability to protect our neighborhoods. Without safety and care, this crisis will continue to spiral further, and I'm not sure what it's going to take for this administration to wake up, but I hope it's not the National Guard.
Thank you very much, Emily. Tom Downard? Tom Downard? He left. I'd also just like to say we've been joined by Councilor Enrique Pepin and Councilor Brian Morrell. Thank you, guys. Then we'll do one more. Betham Codrington? Am I saying that right? Bethann. Gotcha. Bethann Codrington. They're all working.
Good evening, everybody. My
Thank you,
name is
Beth Ann.
Beth Ann.
Yep, sorry. You have the floor in 2 minutes. Thank you.
Okay, my name is Beth Ann Codrington, and I'm an addict no more. I was on heroin, I was on crack, I was on cocaine, shooting it, sniffing it. I did all this. I did it for over 30 years. So what I see, I'm the shout-out lady that used to go down Mass Ave and shout out names. What I see and what I know is that they're not going to resolve this situation unless they arrest people, put them in jail, and give them a choice to either do time in jail or 18 months, because it's going to take more than a year for them to get it right. Because when I got clean and sober, well, I'm an addict no more. I didn't want to stop. I don't want to stop. I walked in church high and I came out to live it. That was 15 years ago. But they're not in the mind. They're not in the mind, and they're not going to stop. I'm telling you, it's good. The high's good. The feeling's good. Everything's good about it, and they're just, they're not going to stop. So if you don't arrest them, instead of you gave them freedom to do this. Yes. You gave them freedom to do this. They're not going to stop. They're just going to go from Mass and Cass all through the city. Like I come out and people are there shooting up, smoking crack, sticking the straight shooters and doing all the. And the bus stops, you can't even go and sit in the bus stop without people smoking and shooting and doing all this stuff. They're not going to stop. You need to arrest them, give them a choice, either do 18 months or 2.5 years in jail. And I'm quite sure, I'm telling you right now, I didn't want to spend time in jail. I went to a drug treatment program 15 times, and they threw me out at 30 days, and I just ended up back. Yeah. Over 30 years I was on drugs. I'm 69.
Thank you, Beth Ann.
This is God. This is God right
Thank
here.
you. And congratulations. No, I appreciate that. Thank you. We'll do Bob Lathrop, and then we'll go to questions from the councilors.
I will stay in 2 minutes. My wife spoke, and she could have been up here all night, I'm sure. We moved to the South End in '86, and we're very involved in the area, as you all are here. And I want to thank everyone who's here tonight, because this is truly a watershed moment. I mean, this thing has been hushed over so long. Talk to the long people that have been, here for 40 years as we have, and seen what we've seen. Everyone knows the problem. I want to we need to focus on solutions. We need to get together. The only thing I can think about in some things is when we moved in here in '86, and the South End was really bad then. I mean, we moved in with a 6-year-old son, and everyone was leaving with their kids because either the school system wasn't good, or all the stolen cars were left on Rutland Street in the South End. Anyway, they had a crime watch back then. And all the neighborhoods got together, and every week they went down to the police stations. I mean, talk about not feeling safe. It was really rough times. And I think we almost have to go back to that, because we need to collaborate together, not only the officials, and we've got some damn good ones up here that really care a lot, but we, the people that are out here, have to take the city back, our neighborhoods back. It's gotten ridiculous. So I ask you, my wife does it all with 311. Every time we go out and walk, she spends an extra half hour calling the city or 311 to fix this, fix that, whatever. I challenge you, and I heard these statistics before about what's happening, and yeah, that's kind of sounds good, but we need change, as someone else said, because it isn't working. My challenge is for everyone in here, not only call 911, go down to be active. Go down. We got to take this back. Go back to the police, your headquarters. We went down to Area D, where I lived in the South End, Blackstone Square, every week for Crime Watch. And we talked about what was wrong. And there was a shitload wrong back then. But in the 80s, it wasn't as bad as now. Now it's horrendous.
Thanks, Bob.
There are other issues. Okay, so people, let's take it back, call it in, follow it up, and there will be solutions. It's going to happen.
Thank you very much, Bob. I will now go to questions from our councilors, and then we'll do one. We're going to do one round. I know folks will have a lot of questions, but we're going to do about 5 minutes each, and then we'll do another huge set of public testimony, because I just got handed a whole lot longer of a list. Yeah, right. So again, I just want to remind folks, we're here to level set, right? A lot of this is to hear from you, but we also want to make sure you are educated on what's going on and what's out there and understanding. So I just have several questions from the administration, just rapid fire, and then I'll turn it over to the sponsor, Councilor Flynn, to ask his questions. But some questions, I guess, Dr. Ojikutu, you may be the best to answer this. What are the number of detox beds that the city has in the city? please make sure you speak, just pass the microphone over. Thank you.
Okay, so we have 2 detox locations in the city, one Dimick, one Bay Cove, and there are 63 licensed beds. That number has gone down over time in terms of licensure, and we certainly need more.
And that's just by the Boston Public Health Commission, or is that's a citywide?
No, this is citywide.
That's
This is in
citywide.
Boston.
Yep, okay.
There are 24 sites in Massachusetts.
Okay. And I know the Boston Public Health Commission gives out needles. Are we keeping count? How many needles are given out by Boston Public Health officials, let's say, average on a week?
Okay, so let me give you the average on month, and I'll go to the week, just
Please.
because I
Yep.
just want to
Sure.
give you the information that we have actually gone down. Our percent, the number of distribution average per month has gone down from 2024 to 2025 by 22%. So we have heard what people are saying, and we're trying to limit, using some strategies, limit the number of needles that we are distributing. In terms of per week, we've also gone down. So last week it was about 14,500. I'm giving averages.
Yeah, that's it. It's important you guys know this. That's why we're asking the questions.
Right, and I can explain why it's that number. If you consider the number of times that somebody who uses...
Folks, please keep it down and listen to the answer. Everybody in the back as well. This is important.
If you consider the number of times that someone who's using fentanyl, which is the predominant drug that people are using in combination with other drugs on the street, is 10 to 15 injections per day. And what we have right now is a situation where we are trying to decrease the risk of HIV transmission, hepatitis B, and hepatitis C. Currently, we have what we're calling an HIV cluster in our city and in the state. And that HIV cluster has started in 2018 and has now risen to approximately 200 cases of HIV, most of which are connected injection drug use, most of which are connected to mass and CAS. That number would be significantly higher. We've tracked it and looked at other cities if we were not providing harm reduction. Okay, so that is why we are trying to decrease the risk of communicable disease. It certainly doesn't stay in any one community. It's certainly something that we need to continue to be concerned about as a city.
Great. And you said, so if that was the weekly, you said you had some monthly numbers?
So the average per month is, this year is 81,112, which is a 22% decrease per month from last year.
From last year.
This
Does
average
that
monthly.
include the other folks that hand out needles? That's just from the Boston Public Health Commission, but
That
what
is from
about
the Boston-
the shelters also give out?
Well, the shelters, that's the Boston Public Health Commission. I'm giving you all Boston Public Health Commission numbers.
Right.
And we are the predominant source of syringes.
But there
in
are
the city.
other sources, I just want to be clear, there
There
are
are
other
other-
sources that hand out needles, so that number
That's
is
correct.
actually larger overall citywide.
That's correct.
All right, understood, thank you. And, no, guys, hey, folks, this is the counselor's turn. Sorry, stop. Hey, you don't have to, Dr. O, please do not answer, because right now it is the council's turn to ask questions. We appreciate it. If you want to ask questions and speak, you'll have to sign up at the moment. Thank you. One of the main core things that we have to do is decentralize services here, right? It's funny, guys, I was actually getting interviewed outside, and a woman came up and said, well, from New Hampshire via Milwaukee, but we decided to move here because it has the best services. So her and her son are homeless, her 21-year-old son, and it's heartbreaking. But they said, we decided to come here because of the service. So we are a victim of our own success as well. So what powers do we have? Well, in terms of providing healthcare, I understand, don't take that out of line. But just our healthcare is great healthcare. What powers do we have as a city to decentralize the services that we offer here? Because I know we're looking at regional approaches as well, but what powers specifically does the Boston Public Health Commission have that could help decentralize these services so it's not such a congregated area?
Okay, so most of the services that we're referring to, so if you're talking about healthcare for the homeless population, the community health centers, if you're talking about our safety net hospital, they're all in the same place. We have 2 methadone clinics in the Mass and Cass area, our AHO program. These are state regulated and operated facilities. For us, AHOPE is funded by the state. We are in partnership with them. They are at the hub table. They are coming to our meetings, and we've been discussing how to decentralize. I think I mentioned earlier that we've been doing what we can as a city, meaning that we've been putting substance use navigators out at community health centers away from the area. We have put other services, vending machines, putting our services, our harm reduction services out of the area as opposed to centralizing all of our work in the Mass and Cass area. But that is the way it is right now, that the state regulates and licenses.
But if the state regulates and licenses it, that doesn't mean it has to be here. Do we have
No,
any say
absolutely
in
not.
where we can locate it? Is citing these programs the issue and being able to move it? Or is it sort of it became here and therefore we just kind of got stuck with it and it grew from here?
No, I would say that if there were other places that we could cite, say the methadone clinics,
Yep.
then we could consider working with the state to do that.
Okay.
I think that we're all aware of substance use stigma and NIMBYism and their challenges with moving things other places. I'm not saying that that's the answer. I'm not saying that we don't keep pushing. We've been having these conversations with the state.
Thank you very much. And just for Deputy Superintendent Humphreys, I know that 50 additional police officers are coming on from the new academy class, coming to D4 in the South End, which I think everyone can appreciate. However, sustainability-wise, are those 50 officers here to stay in D4? Are they just doing their training? Because I know when they come out of the academy and do their training tours, they sort of bounce around. What is sort of the model of keeping that number of police officers in the area so that they can better address the 911 calls that come from residents?
Sure. It's not just the District 4 side of this area. We're also supplementing the staffing in the South Boston side to address all the way up through, South Bay, Andrew Square, all of that. Then we're also doing the same investment of personnel on the Roxbury side to address the issues that we're seeing in Nubian Square. We want to bring back the dedicated day and night walking beats, Golden Park, all this stuff. And the message that the commissioners is delivering is addressing these quality of life issues is a core function of the police officer. There's no better investment than to take brand new police officers out of the academy, put them out on the street face to face with the community, with their training officers, and listen to people and address these quality of life issues. So their baby years as a police officer will be addressing quality of life issues, listening to community complaints and concerns, and developing strategies in partnership with the community at trying to help find solutions for them.
Thank you, Deputy Superintendent. I'd like to turn over Councilor Flynn. Please, you have about 6 minutes.
Thank you, Mr. Chair. I do want to acknowledge the bicycle patrols of the Boston Police Department, the critical role that neighborhood organizations, South End residents, Roxbury residents have played in advocating for that for years. I just want to say thank you to the South End and Roxbury residents for always fighting for that. Steve Fox is here, but there's so many other people that continue to advocate for that. So I want to acknowledge the residents. A great victory for the residents. Dr. Ojikutu, I just wanted to follow up. So on the needle distribution that Council Fitzgerald was talking about, so it's close to 20,000 needles a week that are given out between the City of Boston and nonprofits. Is that about right? 20,000 needles a week?
So last week it was 14,500, but I see where you're getting that number. I'm sorry,
Well,
I apologize.
but maybe
I
not.
apologize.
Yeah, not last week. Maybe like 6 months ago.
Sure.
Is it fair to say that we give out about 20,000 needles a week between the City of Boston and our partners?
So yes, you're close using that number. I just want to say though, Councilor Flynn, I think that this is a really good discussion, but I do want to ground it in the fact that harm reduction is important. And it was your mayor, it was your father who really started harm reduction in
That's
Boston.
right, he did.
Boston has been a leader in this. We have been able to keep HIV infection down because we promoted harm reduction, and harm reduction is the way that we give out naloxone, which has decreased our overdose mortality.
Right.
So I just wanted to say that. I appreciate your support through this, though,
Yeah,
harm reduction.
Yeah, Dr. Ojikutu, you are correct. That was in the early 80s. Boston was the first city that it was needle exchange that was given out during the height of HIV/AIDS. and that was done under the Flynn administration. But my question is, Doctor, is it fair to say about 20,000 needles a week is given out to people in the city of Boston? Is that accurate to say?
Approximately.
Okay. So we're probably talking about 80,000 needles a month, maybe higher. So how many of those needles, Doctor, how many of those and the reason I'm asking about it, I had a little boy from my neighborhood who was 4 years old. He was pricked by a needle in my neighborhood in South Boston, and his mother had to take him to the hospital for two straight months for various testing and shots and medicine. So that's why the issue is very important. But of those 80,000 needles a month, how many do we pick up? And I know Sue Sullivan's team does an exceptional job, but how many does the city of Boston pick up?
Okay, so let me say that we pick up needles through a number of mechanisms. One being Sue Sullivan, the New Market bid. Two being our recovery services program, because they go out, they do proactive sweeps of our parks and schools, and that's been incredibly important. Three, it's our mobile sharps team. That's where you call 311 and you get somebody to come and pick it up. And average time is between 37 minutes and 40 minutes to pick up needles. We've been working on that to make sure that is addressed. We also have an enormous amount of pickup from people bringing needles in. So people who are using are bringing needles back in, which is, I say that, and oftentimes people don't believe me, but that is actually what's happening.
Do you have a number, Dr.
Yeah,
Caputo?
I do. I'm just about to give you, in 2025, the average per month in terms of pickup is 120,000. So we're picking up way more than the 80,000.
120,000
Yeah,
needles
and
per month at the city of Boston. Okay, thank you, Dr. Caputo.
Well, per month.
Thank you. Let me go on and continue and acknowledge the Boston Police in their work. As I was coming down here today, walking with residents from the South End in Roxbury, one mother said to me, "Ed, what about my child that goes to the Orchard Garden School? How am I going to walk my child every day to the Orchard Garden School? Do you have an answer for me, Ed? Is it safe? Is it safe to walk from the South End across into Roxbury?" But what is the guidance we give parents that are doing the right thing, or a guardian, they're trying to do the best they possibly can for their child, but it's really not even at 7 o'clock in the morning, at 6:30 in the morning, it's really not even safe for that parent to take their child to a public school, which is only about a quarter of a mile away. Do people disagree with that observation that this parent told me? So what is our answer? What is our answer to that parent? And what are we going to do to comfort that parent to know that we're able to provide a safe environment for that child to get to school and to get back to school? Do we have any guarantees that it's safe for that parent? Well, let me ask the administration team what their thoughts might be on that, because I do think it's an important question, because it's a question that came directly from the parent. And we do have an obligation not only to educate that child, but to give that child a safe opportunity to get to school and back to school. I don't think we're doing that. Children and seniors. And then let me finish my final point. I've been advocating, as you know, for 8 years for more police officers in the South End and Roxbury. We don't have enough police officers. I go to City Hall, they do an exceptional job. I go to City Hall every day advocating for more police in the budget, fighting for more classes. It's been a challenge, it's been a struggle, but I'm not giving up on the residents of this community or this city, because that parent's voice is important. And that parent is relying on us to provide that safe environment for that child. And whether it's through public safety, whether it's through getting people into recovery services, we have to work together. But I guess my final point is, we just can't allow anyone to use drugs publicly on the streets of Boston. We can't allow anyone to sell drugs publicly on the streets of Boston, to engage in violence in the city of Boston. And you might think I sound like a broken record, but we do have to have zero tolerance for any criminal activity in Boston. That also includes, in my opinion, criminal justice reform in Massachusetts. Thank you, everybody.
Thank you, Councilor Flynn. Councilor Mejia.
Thank you. So I want to thank Mayor Flynn. Because of him, I had a job in the late 80s, early 90s, okay? So I was a community health educator at the height of the heroin epidemic here in the city of Boston. And my job was to educate women who were utilizing, who were being sexual acts, and I was teaching them how to protect themselves while they were out in these streets. And so I think that the time that we're in is very different. When I look at the situation, how has it evolved here now in the city of Boston, we didn't have encampments, we didn't have the number of people congregating in such it's a little bit more overwhelming now than it was in the 80s and the 90s. I just want to note that for the record. And I think it's really important for us to acknowledge that the times are very different, and so are the needs. And I do have a few questions for the administration. I always say this everywhere that I go: Boston is resource rich but coordination poor. And I really would love to hear, we've been talking about this issue, and I'm just curious, and this is why I really like to think about who are the characters that are in front of us right now. But, there's this conversation happening around the recovery center, right? But I'm curious about where the funding and the finances are around that, because I can tell you where you can get that money from. You can get that money from White Stadium, right? Take that money from White Stadium and invest it in the work that we need to do here, and there the problem at least can get a little bit closer to some sort of resolution, right? Because this is going to take investments, right, if we're going to do a recovery center. So I just want you all to know there is over $200 million being talked about right now for White Stadium. We could tap into that little budget to help support this issue. So I just want to go on the record that that's definitely something worth looking into. But for my questions for you all, I'm curious, how many dollars have we spent to date on recovery efforts in Mass and Cass? I know somebody talked about 12 million, but where are we right now in the last 5 years?
So I can provide the numbers from the Boston Public Health Commission. If you add city appropriation plus opioid settlement dollars, it's probably close to 20 million per year. But that includes not only what's happening in Mass and Cass, but it's also happening on our Mattapan campus, where we have, a 75-bed treatment, facility. So, and that includes our homeless shelters, because I'm including them as part of the group of services that are in the Mass and Cass area.
So right now that's 120 million, if I'm doing my math right? 20 million plus 5, I'm not good with math, y'all. So 125 million, something like that?
It's
20 million, okay, my God, y'all don't put me to count dollars, because I went to Dorchester High. Okay, 4, the BPD, curious about your dollars. Tell me how much money we have spent on Mass and Cass in the last 5 years. And if you could just give me the total so I don't have to do the math, I would appreciate that, thank you.
Okay, I'm going to have to get back to you, ma'am. I don't have those figures with me today.
I'm sorry?
I'll have to get back to you, ma'am. I don't have those figures with me today.
Okay. All right. About BRIC. Okay, y'all, BRIC. We have a gang database, right, BRIC? I'm just curious, do we have a human trafficking database?
We do not have a human trafficking database. We do have a human trafficking analyst.
But so then, because, when we're talking about tracking, and we're talking about human trafficking, and we're talking about all of these issues that we're funding BRIC to handle, I'm just curious, what investments are we considering as it relates to human trafficking?
Sure, so we've had a dedicated human trafficking analyst working with that specialized unit.
No, I'm talking about a database, because we're very clear on gang databases, and I'm just curious about a human trafficking database.
Sure, so we maintain a criminal intelligence database that human trafficking related data would be put into, and then we maintain case management systems as a department related to our case management of human trafficking cases.
So then it is fair to say that in the case of BRIC, there is no database that tracks folks who are potentially human trafficking in the Madison Cass area.
I would say that's not correct. We have a case management system as a department where we track that.
And how is that different
information.
than the gang database?
So it's just two different technology systems, I
So
would say.
so let's get deeper into that. So let's look at that system and let's think about what have we learned from the gang database, right? And how can we transfer the learnings, right, to handle the issue that we're facing in Madison Cass?
I would say we're always interested in improving our processes and learning.
So the reason why I'm asking very targeted questions is because, you know, we have this issue here in the city of Boston that I think we have we have different strokes for different folks, okay? And I think it's really important for us to recognize that this is an issue that requires us to really lean into the discomfort around some of the profiling that we do here. Okay, so let's go back to the tension. I'm just curious in regards to how many meetings, because I hear y'all, I'm sick and tired of going to meetings about meetings, which is one of the reasons why now I just look at your Facebook and read what you write and be like, I heard that, been there, done that. But I'm just curious, if we have a task force, which I believe we had once upon a time, that was actively engaged in solution-oriented processes, I'm curious how many of those ideas were actually implemented? Can someone tell me that? If we had residents that were engaging in your process of how we're going to address the issues of Madison Cass, could someone tell me from the administration how many of those ideas actually were implemented?
They can't. Zero. It's zero. That's why we here.
All right, so, and I remember earlier I said that I do have a daughter that I have to go take care of. So don't get mad at me when I leave and when more people got to speak. But I'm glad that I got to. My time is not up, is it? No. I have.
It's up, but.
Well, I'm not done yet.
We've been working together a long time.
But no. But the reason why I'm targeting and being really explicit around the community engagement process is because I understand how frustrating it is to say the same thing over and over and over and expect different results, right? And I feel like we're at a moment we're at a moment here in the city of Boston that is so toxic and divisive. And we are constantly pitting people against each other, and we're all going to be impacted by whatever decisions these 13 city councilors make.
Thank you, Council.
Right? Exactly. And that's why I'm sitting here, my love. I am sitting here. Okay.
Hey, sir, this is one warning. Sir, this is one warning. Again, it goes a warning, and then we have to clear the room, and then you're done. Councilman here, your time is up regardless. So please, one last sentence, and then we'll move on.
So I just want you all to know I show up because that is part of my job. But just like you, I am equally as frustrated about what is happening at Madison Cass. And so I am raising my hand to be a part of the solution, right? And accountability. Because there is a level of accountability that we all have to be responsible for. And I think that that's what we're missing. We are missing the accountability piece. We need metrics and we need outcomes.
Thank you, Council. Thank you, Council. I got to keep moving.
We need
Thank you, sir. Second one, please. I'm trying to move on. Sir, that's another warning for you. I have to do it. One warning's all we get, all right? We're moving on. Thank you, Council. Thank you, Council Mejia. Council President Rusi Loujain.
Thank you, and I want to also, again, thank Central staff for all of their work in making this meeting happen. You are really the glue that's really trying to hold this together, so I want to thank you, and want to thank Dr. Ojukutu, and I want to thank Kelly for all of the incredible work that the CR team is doing. I hear all the residents loud and clear today, yesterday, and I just want to ask, we've talked about it a bit, but where's our conversations with the Commonwealth and the state in supporting us on an issue that is really a regional issue that gets dumped on the city of Boston? So where is the state in this problem, Dr. O? And how are they working with you? And this is not a pointed question to our state representative, who from everything from the bike unit to so much more has been a great advocate, but I think I'm talking about the state writ large in terms of where we're putting how we are working on deconcentrating services, how other towns and cities, more than 60% of the people in the Madison Cass area are not from Boston. They're not from our city. And so how are we working with the state to get other cities and towns to invest in their own recovery facilities, in their own methadone clinics? What are those conversations like? Are they happening, Dr. Ojukutu?
So, yes, we are working with the state, and we have made suggestions in regards to, potential increased funding for different services, and have thought about ways that we could potentially have them more engaged. So what they have been engaged in is the hub table, which Kelly has already mentioned, this round table where we're doing, case management. We also meet with them regularly to talk about the continuum of services and to strategize around improving that continuum for people who do want to enter recovery. So that's where the conversations have gone. They have put extra money into our budget for particularly sharp pickup most recently. So they have been, contributing, and they certainly contribute to our budget for a number of our activities, including AHO.
Thank you. In terms of, there's a lot of carrots that it sounds like the state's using, but are they using any sticks to get because we don't have the authority or the power to get other towns and cities that have this crisis that we have to deal with. We don't have the stick as another city to use against other cities that should be investing. Are there sticks that the state can be using, like leveraging funding to ensure that they're investing in their own recovery services?
Yeah, I don't know the answer to that, sorry.
Yeah, okay. And Dr. O, the frustration is not at you, it's really at the fact that we have to deal with this issue that is disproportionately not our residents. And I love being the capital of this Commonwealth, and I love that we are the economic center, but then these are just things that we have to deal with. And it's unfair to our residents, and it's unfair to the services that we have here where we're trying to deal with our own. So that's just something that I want us to hopefully be working on more. We don't have the stick, but the state does have the stick that they can use to get other municipalities to invest in their own services. Kelly, I want to thank you for all the incredible work that you're doing. Also, Dr. O, when I had the issue a few months ago, Dr. O, you were on the phone with me till 10, 11 o'clock at night, helping to get someone into services. And I just don't know if everyone always sees that commitment. So I just want to thank you, Dr. O. And Kelly, I've seen you at Ramsey Park in Roxbury, literally talking to people, trying to get them into treatment. How do we do that? What is the most effective? The DA's office has services over sentences, right? You get people who have contact with our criminal justice system, you offer them, all right, either you're gonna be incarcerated or you have this option of treatment. How do we get that to happen more?
Microphone.
So when I started with the city, about a year and a half ago, one of the most important things for me was to have preventative and proactive co-response in the city of Boston. It increases the likelihood that people will participate in their treatment planning when there are consequences. There is no, I had this conversation with a constituent this afternoon, that I wish there was a formula that I could say this is the way to do it. But it's a case-by-case, individual person basis. But
and that's what makes it more difficult, right?
Well, right. Of course, it's very complex. But in my experience, someone else said in here, when an individual is suffering with substance use disorder, they're not capable of making good choices for themselves. And sometimes it takes external consequences for an individual to at least try. There is no guarantee. We move people into treatment every day, and sometimes it's very secular, right? But we keep exposing them to the light, if you will, and we hope that one of the times that it sticks before they die, because there is no in-between with this disease. It's jails, institutions, and death. Yeah. So anyways, to answer your question, to increase the likelihood that people will participate in their treatment planning, we include our law enforcement partners.
Right, and that would be the stick in some circumstances that could be effective.
Right, and specialty courts, the judicial initiatives, having the more of a recovery, centralized recovery court and booking system where probation, parole, law enforcement are all sort of in the same room communicating together to address that one individual person for restorative justice.
Thank you.
You're welcome.
And Dr. O, I have one last question for you, because I think everyone acknowledges it's a humanitarian crisis. Everyone recognizes it's a public health crisis, a public safety crisis for residents, for those who are using, those who have the disease of addiction. But could you explain to us again, so that I can understand what a public health emergency would do? Would that just strip away community, what actually happens, and in what circumstances historically we've done that?
So here in Boston, we've only declared a public health emergency one time, and that was COVID-19. What a public health emergency does is once it is declared, it allows us to shift resources, whether that be staff or infrastructure, to address a time-limited emergency. But it does that without the need for public process. So meetings like this, engagement with people, getting constituents' opinions about what's happening, that is not what happens. In fact, it takes that away when you have a public health emergency. And that's why it's very important that be time limited. And that's why, when we declared it for COVID-19, we pulled it down by 2022, when it was time to, when the height of the COVID-19 pandemic sort of decreased. So I think that there are several reasons why we don't want to declare a public health emergency in this case. One, as I said, it's not bringing in additional resources to this. I've already given our numbers in terms of the resources that we put forth every single year to Mass and Cass. It's not going to bring in anything additional to this issue. This is a humanitarian crisis, and I'm not underestimating it. I'm not denying that it is urgent, that it is important for us to manage, but that's not going to change the circumstances materially for what we have in terms of what we have available to deal with the crisis.
And so what will, if it's not a public health emergency, we put that to the side, what is going to help us move the needle in the fundamental way that I think residents are asking us to stop talking and actually moving things to action?
I can only speak from a public health perspective. I'm not here from the public safety, looking at this from the public safety lens. From the public health perspective, I believe that we need a recovery campus. I believe that we need a way to move people into a continuum of services that actually links them from that medically managed withdrawal stage, the ATS, the acute treatment services, the detox, into the next series of treatment stages. What is happening in many cases is that people they're going to detox and then they're leaving detox.
Yeah, because it's too short.
Well, it's not only that it's too short, there isn't necessarily in every case that true hand-holding and navigation that's getting people from step 1 to step 2. If you look at state data, and we just got this data recently, only 44% of those people who enter detox are getting to that next level. Okay.
And so where do we locate the recovery campus? I think that's
the conundrum. That is the conundrum. Where do we locate it, and where is the money coming from? I think those are the two questions to answer.
Okay. Well, Councilor Fitzgerald's telling me my time is up. Dr. Ojikutu, I want to thank you again for your work, and for everyone for all of their public testimony. And hopefully we can get at solutions that I think are desperately needed. Thank you, Mr. Chair.
Thank you, Council President. Councilor Santana.
Thank you, Mr. Chair. I also, in my opening remarks, failed to mention the lead sponsor. Thank you, Councilor Flynn, for filing this. I appreciate my colleagues for asking the questions. I know there's a lot of people who are signed up to public testify, and that's what I want to hear from. But I just have one or two questions. Dr. Ojikutu, you just talked about people going into treatment and going into detox. When people are going into treatment, how long are they required to stay there?
So if it's voluntary treatment, there's no requirement to stay. The average length of ATS or detox in the state, if you look at state numbers, is 6 days. So we say about 5 to 7 days is detox. Then you go into the sort of step-down services, because obviously that's not enough for somebody to, enter recovery.
So you're talking about, that's the detox, so 6 to 7 days, and then the treatment itself? I know it's voluntary, but how long can they stay there for?
So there are different stages of the continuum. So stage 1 would be detox, or medically, where withdrawal is medically managed. So the range of time is between about 5 to 7 days for somebody with opioid use disorder, whether it's complicated by other drugs. On average, it's about 6 days, just to be very clear about the statewide data. Then one might go or should go to the next step down location, which would be, we call CSS, Clinical Stabilization Services. So you continue to do medical management. This is where one might start methadone. If they started there, but then it would be managed. And you work on case management, and you work on behavioral care and all the things that you need to recover and get back into life. And then you move on to what would be called TSS, or Transitional Support Services, Transitional Stabilization Services. And that is another spot where you would basically, again, learn life skills. A lot of folks have been out on the street for a long time. They need assistance. They need additional case management supports. And then that whole process is what I would say is the sort of beginning of recovery, because it can take a very long time for someone to truly be in recovery. And then certainly because addiction is a chronic illness, you can have relapses.
Thank you, doctor. I think I think we heard from one of the residents, I forget their name, but that was a recovering addict, and I think she mentioned it was 18 months. What's that? Beth Ann. Yeah. So I think that's an area that I definitely want to be able to advocate for. I think the treatment and that people are given are too short, and I think with the issues that we're dealing with, I know it's voluntarily, and I think we need to figure out creative ways to make these treatments longer, so that way we can actually impact and people and have more success stories like Beth Ann. So I'll yield my rest of my time. I really want to be able to hear from you all, and I know that that's what you want. You all want to do that. So thank you, Mr. Chair.
Thank you, Councilor Santana. I just do want to add on the regional approach. I want to remind folks, I have filed for a hearing to look at a regional approach to this, because when we think about this, I just want to make sure the narrative is out there. When we talk about Recover Boston and this campus that we're working on to fill this middle gap of the continuum of care after detox, it doesn't have to be in the city of Boston, right? And I want people to understand it does not have to be here. I'm sick and tired of people raking their leaves onto our yard and expecting us to pick it up, right? So we're going to try and look at other places. But it just when we think about Recover Boston, just because it has Boston in the name, it does not have to be cited here. As Councilor Louisiane brought up, where is the state on this? Where is other folks that we can do this? So thank you all for bringing up those points. Councilor Durkin, the floor is yours.
Thank you so much, Councilor Fitzgerald. And I just want to acknowledge that I objected to this being voted on same day. And I want to acknowledge that how angry some of you are at me for my actions. I personally, I think a lot of folks in this room I've actually spoken to, you reached out to my office. And I explained my reasoning, but because this is a broader audience, I want to explain my reasoning to you today. It's so important for me first to say that I deeply care about this issue. Boston has given me everything, and it's not right that some of you have experienced some of the things that you have brought up today. You deserve to have a safe community. You deserve to have a safe you deserve to live in a neighborhood where you feel like you and your families are safe. So homelessness, drug abuse, and addiction are not South End issues, and it's not the issue of one or two district councilors. It's the issue of all of us. So I wish all of my colleagues were here tonight, and I'm really apologizing for my lateness because this was scheduled so late I had another commitment. I want to acknowledge the work of the Boston Police, the way that they put on their uniform and go into a situation where many of us feel unsafe walking through, but they actually have to do the work of talking directly to these folks. And I want to acknowledge our CRT team. I think what we've heard already is that we don't have a centralized recovery service. We don't have centralized recovery services. I think for me tonight, the goal is not to determine whether we need to determine a state of emergency, because I've been very clear that I don't think the Boston City Council can do that. But tonight, the goal is to hear from you. And I just want to acknowledge, I know people are upset. I have heard this and I am hearing grumblings now. I completely understand that. it's my job to be accountable to the voters, and it's my job to be accountable to you as Boston residents who pay all of our salaries. So I will be staying to talk to whoever after this, and I will be staying, and I want to hear from you directly. The few questions I have, I know Ruthie asked one of them, or Council President asked one of them. I don't think the state is stepping up enough, and so I think that question has been answered. But I would like to ask the administration how the encampment ordinance has impacted police work and CRT work in the area.
Sure, well, I can take the meeting part. Part of CRT's responsibility is coordinating response to all quality of life concerns in the city of Boston. We uphold the encampment ordinance. We have found that only 8% of our calls have entrenched barriers. Because of our encampment ordinance, we're really focused on ending outdoor substance use.
Has that contributed to some of the negative externalities that, I mean, because essentially if you were in a tent, you wouldn't see people shooting up. So I guess what I'm asking here is, has the encampment ordinance contributed to negative externalities that residents are seeing?
Hold on, please.
The reason I'm asking that question is because the use of seeing public drug use in public is something that obviously we were seeing public drug use. I just want to ask this question, and I want it on the record.
Ma'am, please. Just does the panel understand the question?
I think so. So the encampment ordinance, we have to go back in time to when we had a permanent encampment on Atkinson Street. And from my opinion, it was a very valuable tool in allowing us to come together as partners and do individual case management for each Sue, you were part of this too. We did individual case management for every single person on that street. And we did a lot of family reunification. We did a lot of movement into low threshold housing. A lot of really good things happened. But what we needed was, in the moment, the existing rules for encampment. Basically, we had to post it, and there had to be 48-hour notice. On that street, there was very serious issues. We had okay, so
No, I
know
mean,
what we're talking about.
I obviously agree. I voted yes on that ordinance. So.
Yes, 100%. The encampment ordinance gave us the legal framework to decamp that street and do a lot of things. We have not arrested one single person under the encampment ordinance, but what it allows us to do is, in the moment of interaction between that person and us or our partners, say, you're either going here to a shelter or some sort of thing, or you're going with us.
And I know I'm likely running out of time, so I want to put two questions on the record. How many people have been moved and transitioned to supportive housing from Mass and Cass? And then the other question is, has this, and it sounds like you have, but has the city fully weighed the pros and cons of an emergency declaration?
Do you want to give a quick answer to that, panel? That's fine.
Sure. So when we established the low threshold housing sites, that was when we were moving people from the encampment and trying to situate them in more stable circumstances. Since then, since January 2022, more than 800 individuals have utilized the low threshold sites. Unfortunately, some of them have now been closed because there's no more funding for them. We will continue to maintain the ones that we have, Envision, one at the 112 Men's Shelter and one at the Woods Mullen Shelter, and that's a total of 147 beds.
Okay, and I'd just like to put on the record that I think that is the ask for the state. How can we possibly deal with this issue without additional state funding for this? Thank you.
Thank you, Councilor Durkin. With that, the round of questions from the councilors is over for panel one. I couldn't even see it, Delia. I'm so sorry. We've got one more councilor, my dear friend, Councilor Papen. I apologize, sir.
That's okay. I also would have rather hear from the audience than myself. But good evening, everyone. Councilor Enrique Pepin here from District 5. I represent Rosno, Hyde Park, Mattapan. But I think that the reason why I'm here tonight really is because this isn't a topic that just impacts one certain part of the city. when I look at what is happening in Mass and Cass, I also see it trickling into Mattapan Square, Wolcott Square, Clary Square, and Rosnell Square. It's something that all 13 of us, including the administration, including the state and the federal government, we have to put our heads together in order to find a solution here. Which is why I'm so glad that the room is packed today with residents, because it also is important to hear about the perspective of what you all are going through. For many instances, I've heard also, I want to give a shout out to the owners of Doña Habana that have been going through God knows what for quite a bit some time since buying that spot, Hector and Nivea. I also just, despite I don't represent you all directly in this, I do get your emails and I see them and I get to hear about the lived experiences that you have gone through, which leads me to my first question to the admin, and it's more of a long-term plan for the area in terms of the way that the area has been impacted because of the drug addiction and the just quote-unquote Mass and Cass. I know that I'm looking at Mingo right now, coach of the Bengals, you know, how Clifford Park finally got some investments, but I want to know what else has the administration looked at to help assist with all the detriments that this area has gone through in the city of Boston? Is there a long-term plan that you guys are looking at, how to support the businesses, the residents, the neighborhood groups, et cetera?
Anyone who feels they can respond to any part of that is more than welcome. And if there is no one here required to, with the information to respond, so be it.
Sure. So, like I talked about earlier, and we can get into more specifics, we're in the middle of a significant investment of personnel and a shift in these areas related to the community complaints. What we will see in the very near term are additional officers on the street. We're going to see enforcement. We've, like I said, we've over doubled the size of our street outreach unit that's going to work hand in hand with CRT. We will see them out there in the very near term. It takes a little while for us to ramp up when we reinvest officers into the academy. It takes 6 months for them to come out. They just came out. You will see them out there. And we are going to deploy them right where we're hearing that we need them. So that's what the Boston Police Department's going to do to answer that question.
Okay. And what would be the follow-up process to make sure that, let's say, I don't know if you detain them or you take note of who the people are. Is there a step-by-step process that the BPD is going to take in order to make sure that those individuals that you start to identify don't continue to be repeat?
Sure. I think when we talk about, we could talk about specifically the section process. Our section numbers are double this year from last year, and many of that starts with an incident report or an observation based by a police officer, and it's worked in conjunction, whether it's CRT or us, or sometimes family members will file the section on the individual. And so when we see repeated behavior where a person can't care for themselves or they're a danger or something like that, we follow through with that. Another thing that we do is through our field observations and stuff like that, we do see who's out there. But I think the most important connection there is if we have police officers in the community in the same areas day in and day out, they're going to know who's out there, and they're also going to be in direct contact with community members that are going to tell them what's going on. And so that's what we're going to try to be very intentional about in these areas that are affected by these issues, is putting officers in the community, interacting with the members of the community, but also those officers will be there day in and day out and see who's out there doing what.
Okay. No, I appreciate that. And I want to view this conversation tonight. What's that? Oh, sorry. I also want to view this conversation in the eyes of not just supporting those that have been affected, but also making sure that we are acknowledging that the people that are suffering from a drug addiction oftentimes cannot vouch for themselves. So I want to ask anyone from the Public Health Administration, what type of collaboration exists with existing hospitals or institutions or just any neighboring groups so that, to Councilor Fitzgerald's point and others, we are working collaborations that the City of Boston are not the only ones coming up with the answers?
So I think that our goal has been to work in collaboration with all of our partners, whether they be healthcare partners or our provider partners. I think we have been working and coordinating our services. I think the best example of this is this new hub table that was described earlier, where we're coming together and really intentionally thinking about each and every person who is at highest risk and working in a more coordinated way together, because that doesn't always happen and hasn't always happened, to get people off the street. I think one of the lessons that we learned from the decampment process and moving people into low threshold housing is that we need better coordination and integration of our services. And like I said, our system as it stands doesn't really necessarily support that. So we're creating it, and we're pulling people together and saying, look, we're going to be accountable to what's happening here. We're going to have reports on each and every person who is brought to this table, and we're going to work together to ensure that they have access to all the services that we think they should have as they deserve.
Okay, thank you for that. Councilor Fitzgerald, do I have time for one more question?
Absolutely.
Well, I think one of my colleagues mentioned the importance of Recovery Campus. I think that is very important to address the very issue that we are trying to tackle here today. I know that I was able to just look up here how the Healy Driscoll administration did put out an RFP for potentially a recovery campus site, the different locations. I don't know. Is this what's an RFP? Sorry, we use a lot of acronyms. A request for proposal for a recovery campus. I know that the Shattuck Hospital is a site that was looked at. I just want to know, are these still conversations happening? Because we do need to get that opportunity if the state is willing to offer.
So yes, the conversations are still happening. The original proposal that was being led by BMC, it's not moving forward.
Okay.
So the plan is to do a process, a community engaged process, as I understand it from talking to Secretary Mahania, and then to reissue another request for proposals. And I don't know the timing on that, to be honest with you.
4 or 5 years.
Yep, it's
All
not
right.
under,
All right.
it's honestly not under our control. I'm just reporting
Right.
and answering the question that is what's going to happen, as I understand it.
So do we have to look for a new partner in terms of a hospital willing to take the initiative?
Well, I think that they are working on that. I mean,
Right.
we are certainly talking to them about it, but it really is the state that's running the Shattuck process.
Okay.
I mean, just trying to be as transparent
Yeah,
and
yeah.
clear as possible.
No, just trying to see where can we work with our state partners to be
Yep.
able to potentially find that solution there. But sad to hear that BMC is no longer leading that. But thank you for the answers. Thank you all so much for hearing me out. Thank you, Counselor.
Thank you, Council Pepen. So now, right, there's no one else at the end of the table there? We're good? Council Laurel, I knew, all right, came back. Council Laurel? This is how this is actually the procedure of a hearing, guys. This is the natural procedure of things where each councilor does get their time to question the panel. So that we're not doing anything out of order, anything else that would happen if we did it in City Hall as well.
Yeah, and I'm going to ask a few couple questions, and I know the public has been here, so I'm going to defer the rest of my time. Just 2 questions, quick questions. Is BPAC is decentralizing some of the service, whether it's vending machines into health centers and provided training. How are you measuring whether this actually reduces the burden on mass and CAS? And then also, when we're decentralizing, can you talk to me about, is there any community process on putting those services inside of those neighborhoods?
No, I think that's a really great question. One of my goals has been to seriously evaluate all the interventions that we do. As we move things out of the Mass and Cass area, we really have to think about the amount of movement, right? So putting substance use navigators at some community health centers and moving vending machines out is a small thing. And I want to be, again, very transparent. These are things that we have control over and we've done them, but it is a small action. But in complex or in integration, in coordination with all these other activities that we're doing, getting people into treatment, getting people reunified with their families, we're looking at how many people are congregating on the street on a daily basis, on average. We're looking at data like how many people are actually going into treatment, how many people are going into housing. So we're looking at outcomes data while we're introducing these new interventions. So that's a big piece of what we're doing.
And then my last question is the hub table. Who is at the table? How are they formed? And are residents and the public able to get how are residents and public able to get information from what's happening at the hub table? And how are also individuals being tracked?
So let me go back. I didn't answer your other question. I apologize, Councilor Worrell. I didn't say that there was a detailed community process in regards to the public vending machines. There was actually focus groups. There were interviews. This is from our part of it's from opioid settlement dollars. You know, we've been doing all this very detailed process. So it wasn't just done, without telling people. Okay. So in terms of the hub table, the people at the table primarily are healthcare providers. They're service providers. They're long-term partners of both the Boston Public Health Commission and the city writ large, also state partners, and certainly the police, public safety partners. All of them are at the table bringing resources to bear to work with individual people who are at higher risk and try to determine how we can move them to a different sort of state, a healthier state for themselves, a healthier state for the community. In terms of community updates, I think we just got this started. We've had 3 meetings. The third one was this morning. So I think that we need to sort out a way to, let the public know exactly what's happening in this process and what the outcomes are.
And then how are individuals tracked?
So they're tracked within the context of the table, meaning that if it's 20 people, we haven't even started.
Okay, got it.
Meeting,
all right.
But if there are 20 people who are being case managed, then we would be tracking what percentage of those people are actually leaving the street.
All right. Thank you. No further questions, Chair.
Thank you, Councilor Worrell. Now, with that, Panel 1, you are excused. We hope you can stick around and listen to further testimony from folks, but you are allowed to grab the table. The folks from Panel 2, we're going to do testimony first. Don't worry, folks. But the folks that are in Panel 2, which is also the community, all the the South End Civic President leaders, as well as the Executive Director of Newmarket Square, BID, you guys can come up to the table. That will also open up some seats. And I don't know if you could, anyway, if you have an open seat next to you, could you just raise your hand? Just to make sure, I don't know if anyone else in the back, so there's some seats available. If anyone standing would like to come sit down. They're not leaving, guys. I just said they're welcome to stay, and they said they would. But right now we're switching. This is the panel table. The second panel's coming up, and they will take the seats of those that are moving. But I appreciate the concern. We got it. While they're doing that, I'm going to call up a couple more names, public testimony. But if the civic presidents that are here on panel 2, please come on up. After Dr. O. So, folks, we've got a number of names still on the list to rattle through. I think what we're going to do from here on out, I will give, when there's 10 seconds left, I'm just going to give a gavel, a hit of the gavel. That means that's my signal to you to please wrap it up within the next 10 to 15 seconds. We want to make sure everyone does have an option here. Good. That's fine. Elizabeth, thank you for coming. Appreciate it. We have a Louisa Giannakis. Louisa, if you were still here. Great. Louisa, we could start with you. Please come up. And then after that, we'll have a Yolanda. Is it Yolanda Streeth? Yolanda, Dorchester, Mass. Yolanda from Dorchester, but I believe it's an SH. But so we'll have Louisa, Yolanda, and Robert George, if they are still here. Louisa, you have the floor in 2 minutes, and again, I'll give you a bang of the gavel when it's time to wrap up. Thank you.
Thank you very much. Good evening, councilors and members of the public. Thank you for your time tonight. My name is Louise Giannakis. I live on Rutland Street with my husband, my 3-year-old daughter, and as you can visibly see, soon to be our second child. I love living in this city, and I want to raise my children and continue to live in this city. I want to start out by saying, I assume you all know, but I realize I can't assume, that there have been over 100 people outside throughout different points in the night tonight. In my professional life, I present often in front of municipal boards. I've been across the Commonwealth in front of various zoning planning boards. I respectfully have never seen such a botched public process as this hearing tonight. You have had over 100 people who have not been able to meaningfully participate and engage or hear anything that is happening in this hearing tonight. So I assume you know that, but I expect you'll be hearing a lot from constituents about that fact. I'm here today respecting that this is an immensely complicated issue with no single solution, but in the interim demanding, as I have heard others on this council do before, an increase in basic city services for the areas surrounding Mass and Cass, including Roxbury and the South End. This problem will not be solved overnight, but in the meantime, we deserve city services proportionate to the problem and not, as others have said, warp statistics that redefine what safety is. We as residents know we are not safe. As a resident, I echo the many complaints and experiences of the dozens that have spoken before me. Just days ago, as I went to get in my car parked outside of my home, load my very pregnant self and my young daughter into her car seat, I quickly realized that my car had been broken into for the 3rd time in recent years and used as a drug den overnight. On the seats were open needles, used gauze, and trash littering the entire car. I spent hours combing the car with a BPD officer who was very empathetic and kind, and we appreciate your work, combing the car for a needle for fear of sitting myself on a needle in the car or having my dear daughter reach into the cracks of the car and finding a tiny needle. We then delayed our trip, and my daughter missed a very special and long-awaited art date with my mother, her grandmother, who she rarely sees. And I realize that this is a blip in the radar of crimes and stories that have been shared tonight. But I share with you this because sometimes it is the littlest things that send you over the edge as a resident, and you say to yourself, I have had enough. And at that moment, for the first time in my residency in the South End, I thought to myself, I have had enough. I no longer want to put my children through this, and I no longer want to live here. And it pains me to say that. If you knew me personally, I bleed this city. I've worked in this city for 10 years. I want to grow here and become a part of it and be involved and grow my children here. My message today is this: residents are leaving. As a parent with young children, I'm very close with other parents in the community. My daughter has been at United South End Settlements for 3 years, and I hope and expect that she will continue on to Boston Public in the years to come. I have heard from dozens, literally dozens of parents over the past few months and year. They are leaving the city because, like me, they have had enough. Incident after incident starts to accumulate, and you no longer want to put your children through those experiences. They are withdrawing their children from our Boston public schools, they are buying homes in other towns, and they are paying taxes elsewhere. We will have a tax valuation problem. We have had and will continue to have real estate valuation problems and enrollment problems in our public schools. Residents are frustrated, frankly, have lost hope in the effectiveness of City Council and our law enforcement, and I hope, please, that you hear all of the many, many voices tonight, the continued voices over the time to come, and I certainly expect that there will be a continued public process that is improved from tonight's hearing. Thank you very much.
Thank you, Elise. Appreciate that. Yolanda? Going once. All right. Robert George? Robert George? Page 2. Sorry, page 2. Cornelius Hood? Is Cornelius still with us? Hi, sir. You have the floor in 2 minutes. Thank you.
Hi there. I wanted to just say I'm a co-president of a neighborhood association. I live in the Curly Blocks district. I just want to say, sitting here, who else pays their taxes here? Who else pays rent or a mortgage? Who else dutifully puts out their trash on the day or the morning of their trash? I'm going to say, sitting here and listening to the public health thing, giving out 81,000 needles, by the way, using a 1980s solution for an HIV cluster, we have PrEP. don't give out the tools to do the drugs. I'm sympathetic to it, but this city makes you feel, this whole Commonwealth makes you feel like a chump for paying your mortgage and following the rules on time, right? If I don't pay my taxes, the city's gonna put a lien on my mortgage and they're gonna sell it out from under me, okay? But people are allowed to do drugs in the street, they're allowed to defecate. You will, to the prior point, and thank you to the person who's no longer here who testified to being an addict, we are creating a false bottom for people. They have no incentive to change, and meanwhile, your tax dollars are leaving the city. I love the city. I blow the sidewalks every day that they are coming by to sweep the streets. And I'm sorry, I'm usually more articulate. I'm just so upset. And I tend to the sidewalks. I can't even do that anymore because there's so many needles, okay? I'm texting my neighbors who have a toddler saying who loves flowers. And when the daffodils were up, I texted them and said, please watch her, or I will cut down those flowers because there have been 4 needles I found right outside of your apartment. Thank you.
Thank you, Cornelius. We're going to have a Rick Winterson and then a Griffin Safile. Great, Griffin, you're here. Great. So if Rick is up first, if not, Griffin, why don't you make your way to the podium, and then Antonia Edwards, I believe. Is Antonia still here? Okay, she's still here. Thank you. Griffin, you have the floor in 2 minutes. Thank you, sorry.
Thank you. For starters, I've been here since 2021, living here full time. The South End, back then, the problem here was the problem down the road a little bit. I live on Mass Ave. 2 weeks ago, somebody got shot in my backyard. 20 minutes before my wife walked her dog. That could have been her. We're just letting this violence happen. We're letting people die out there. We're just allowing it every single day. We're better than that. We just are better than that. Every business on my corner has experienced damage this year. It's never been that bad. How dare we just say that that's okay, have a hearing about it, delay the conversation. Thanks for that. Somebody got shot in my backyard since you did that. Thanks. I'm really upset about it. I want to live here. I bought here to live here. You're making me reconsider that with the actions you guys have taken. People are dying out there with the actions you've taken. Just the way the world is, apparently. We're okay with that? We're okay with that? No, we're not. Thank you.
Thank you, Griffin. Antonia Edwards. And then after that, we have adding James.
First of all, I want to thank the panel, distinguished panel, for being here, and thank you for Ed Flynn.
Speak right into the microphone, please.
First of all, I want to thank the distinguished panel, the City Council, for being here. And I thank you, Ed, for bringing this to attention. I have been in this community, or my family's been in this community since 1940. We've lived in the Nubian Square, now named Roxbury area of Boston, since the 1940s. I'm 59 years old. I have never seen my community this bad. And I've seen the crack epidemic. Nothing looked anything like it does in this community. I can't even walk outside. My mother's 78 years old. She can't even come outside in her own backyard without being accosted or being harassed by the opioid epidemic people. I don't know what you want to call them. I call them drug addicts. I am so sick of putting my life on the line to call the police or approaching them to get out of my backyard only for the police to come and scat them away. They're scattering them away, watching them buy drugs. They're scattering them away with drugs in their needles. And that did not happen during the crack epidemic. I still have people in my community who are arrested from the crack epidemic who are in jail now. So there's two sides of Boston, of the city of Boston. And so these people who are inflicting these endangerments on are a risk to themselves and our community. So it's a public safety emergency. Just yesterday, I have a video right here. I'm at the dentist in my backyard. This lady stripped naked in front of my mother, shot up in her groin. We called the police, my dentist did. The police came. She had the needle in her hand. She forgot what she was, and she started smoking it. The needle point was for the police officers. She could have stabbed them. They shooed her away. She never got arrested. So this, in my backyard, which is residential, I'm right behind B2. I'm right there near the veterans area. Every morning, they're out there. They're in my backyard at 7, 8 o'clock in the morning, drinking, getting high. And if I say something to them, now I'm in a battle with them. So my thing is, how do I protect me and my mom, who's 78 years old? And I think it's ridiculous that we have to live like this. There's no quality of life in Nubian Square. There's no businesses because nobody wants to do business there. We're the only community in Boston that's a desert. We don't have a community store, a convenience store. We don't have hairdressers. We don't have nail salons. We don't have cleaners. We don't have anything because nobody wants to come to Roxbury. Because Roxbury has historically had a stereotype of being the worst community in Boston. And as Ms. Lou Jean said, these people aren't even from here. 60% of these people are not from Boston. And so I watch every day when I'm all over the place. I'm in Nubian Square at least 5 or 6 times a day. I see people selling drugs in front of the police officers. I see them not arrested. I see people getting high. I see people passed out on the sidewalk. Excuse me, I gotta walk over them. Excuse me, can I get to the sidewalk? My mother's on a rollator. If I take her outside, I literally have to walk in the street to prevent from being in contact with these people. Defecation all over the sidewalks. It smells like poo-poo and pee-pee all day long. They've taken over Citizens and Banks. They sit on there all day long. They've taken over the corner with the Chinaman. The poor man can't even do business. They're everywhere. So what are we doing about our kids back at school to have to see this every day? These acts where they're pulling their pants down, they're shooting up in their groins. This lady tied a shoestring from her shoe around her arm with the shoe hanging and shot herself up in Nubian Square. So we deserve better than this. And we're paying tax dollars, so it's not just Mass and Cass. They fled Mass and Cass, and now they're in our community. But of course, Roxbury, who always gets the bad reputation, who always gets the stereotypes, and they're left out. So I don't want to hear about Mass and Cass.
Thank
I
you,
want
Ms.
to hear
Evans.
about the whole city of Boston in that area and D7. It's D7
Thank you.
that's been inflicted.
Thank you so much.
Thank you so much.
Appreciate it. We'll have Adina James, Christina Dorabek, and Jesse Cheng Schreppel. Sorry if I'm butchering these names, but Adina James, Christina Dorabek, and Jesse Cheng Schreppel. Any three. It doesn't matter now. Just come on up.
Hi, thank you for hosting. And I think.
Can you state your name? I'm sorry.
Christina.
Thank you.
Given the temperature in this room and the number of the people, I think you can tell how frustrated and scared and upset we are to have sat through 90-degree heat to speak to you. So we appreciate that you're here. I'm a resident of the South End, a proud one for over 10 years. I have the privilege of choosing to be a resident of the South End, where I raised my 7-year-old daughter and my 2-year-old son. And I thought that we would be people that live here forever. I love the city. I always tell people I've chosen an urban childhood for my children because of the cleanliness, the safety, the beauty that is the city of the Boston. But I've definitely witnessed changes. And this is no longer a Mass and Cass issue. This isn't a Roxbury issue. This isn't a South End issue. I think anecdotes are really dangerous, but they're also really powerful. There's dozens and dozens of other families like me who live in all of these neighborhoods who could tell you stories just like the ones that we've heard that are very upsetting. But I want to share 2 really quick ones because what to me the biggest, if I had one takeaway that I could give you all tonight, it is that this truly is a City of Boston issue. Over the weekend, a holiday weekend, my husband and I took my 2 children to Copley Square, which is not yet complete. I think the Sagrada Familia might win a contest on completion. I'm not sure, but that's neither here nor there. And they were learning how to ride bicycles in the middle of the afternoon. And a group of people came into Copley Square, the center of our city. And my daughter, I saw her stop on her scooter and look up, and a man was shooting up a woman in the neck. So this is not just in Roxbury. This is not just Mass and Cass. This is not the South End. This is in broad daylight in the city of Boston. And so what did we do? I called 911, and I sat there on a bench and waited for 45 minutes because when the police showed up, I wanted to talk to them. And I wanted to say, this is really upsetting for me. And nobody came. So after 45 minutes, I left. And the next 2 days, at the same time, I went back, and it's the same group of people sitting there doing heroin, doing illegal drugs in public. And I called 911 because we should all be calling, and I'll continue to do it, and nobody showed up. If I double park my car on the street that I live in the South End, I will get a ticket in 20 minutes. But if I call somebody is doing heroin and sticking a needle in their neck in Copley Square, I don't know. And I don't blame the police. But what I do think is that incentive drives behavior and disincentive drives behavior. So if there is no consequences for this woman, sticking a needle in her groin in this woman's backyard, and there's no consequences, it's just going to get worse and worse and worse. And I would hate to see this city that I love so much become San Francisco, where nobody wants to live if they have the privilege of having the choice. And so I thank you all for your attention to this issue. This is a city of education. There's a lot of smart minds here, and there's a lot of people who had 30% tax increases in their property taxes, including myself in the last year. And we would like to see it addressed. We want to choose to continue to live here, and it's very sad to see how bad it's become. Thank you.
Thank you very much, Christina. Jesse, I don't think is here. Maggie Garmer, Kevin Conley, or Jerome Frazier. Maggie Garmer, Kevin Conley, Jerome Frazier. Good, sir. How are you? You do whatever you got to do.
My name is Jerome Frazier, and I am homeless. I've been homeless for 7 years. And I want to say that when I leave here, I'm going to go be living with those folks every day. So I want to say this to you right now, that there's a lot of us that are participating in this room that's homeless. And I want you to know that those folks that you see out there every day, the numbers are getting less. It is getting less. If you really pay attention to it, it's getting less. So with that said, I'm going to turn around and speak to the council. So council, let me just say this. So I've made it my business over the past 7 years to go out and reach out to people that I live with that are drug users, broken homes, and had situations like myself, was accused of a whole bunch of stuff that all the cases were dropped. So, but I managed to stay. And I want to say this, and I said this to the officer out there earlier. The situation is this. When the people understand, my IQ is 137, some of these people's IQs are 150, 160. They're a lot smarter than we are. They understand how it works. We need the court system. We need the judges to agree to enforce them to take their medication, to have them evaluated, and to say that they're incompetent. With that, and I threaten them all the time, I say, listen, I'll tell the council over here, listen, when you go to the court, I'm going to call the court. For whatever reason, Cambridge, I get a very good success. I'm going to call the judge and make sure when you sit down with that judge is going to mandate you to have the lawyer do an evaluation. And when that lawyer comes back, that lawyer says he's incompetent. And then it's section. We need judges, trust me. Start with the judges, because they are the ones that's making our lives hard. Because 30 days, 20 days, 5 days, it doesn't work. Now, I'm one person. Where I live, everybody knows. I talk to the captain. My building is great. No problem. They're afraid. If I walk out that door right now, you watch. It's just like they just spread, they just move. We have Barber House, we have McMahon, we have Project Place. I was in Project Place. We have also City Hospital. We have programs. The issue now, I'm telling you right now, it's the judges. Get to the judges. Stop whatever you're doing. Stop whatever you're doing. Have these judges, section them, have them evaluated by the lawyers. Trust me, you'll see a change.
Thank you, sir. Thank you. Okay. So we will have, after that, Hanouf El-Hassa. Hanouf? Yep. Kevin, thank you for raising your hand. Oh, it does, all right, so either one. Go ahead, ladies first.
Oh, ladies, listen to the chair.
Okay, so I talk to you guys? Okay. So my name is Hanouf El-Hassa, and I've been resident of or a guest of Woods Mill and Shelter. Is a wet shelter. I used to live with a lot of drug addicts. I understand. I've been with them to eat and to sleep, and I understand them. And I've been seeing a lot of violence going on inside these shelters against them by the police or by the staff or even by emergency room, just around BMC and everything. So there is violence going on in certain places by these people, by either police or by doctors or by staff and shelter. So the problem is that these people, when they see violence inside, they go outside. When they go outside, they go either Albany Street, where there's a lot of drug use, or they go inside in Massacas. The situation is that we've been trying to raise our voice to help these people for their human rights to be protected. Either right to life, right to food, right to housing. As you have known, I don't know if you know about this, but there's many that is in priority process for housing that has been 9 months in priority. We've been asking for expediting these houses. No one actually give attention to it. So there is no housing available for them. There is no places to help them with the basic needs. Basically, there is harm reduction we need. There is the overdose help that we need. There is also drug use. I understand the direction of the police. They want to stop drug in Boston. They want to prevent drug when possible. We hope that could be possible, but this is the reality, the direction of the United States right now, that we have to handle the problem. We have to have harm reduction help. We have to have overdose help. We have also to have a drug use help. So this is the reality that we need to face, that not the direction of the police, but the direction of the United States. The United States now is doing everything best to help these human rights protected for these people on the street. Suppressing them, blocking the street under public emergency, which is not the city council actually jurisdiction, neither the mayor Wood jurisdiction, is the Governor Haley jurisdiction of the President of the United States to declare a state a public emergency. This is one thing. The second thing is that what happened in Massacas is not a threat to the life of the nation. I've been hearing this so far, so many arguments. There is no one argument presented to the city council that what happened in Massacas or Albany Street by these drug users is threatening the life of the nation. When it's threatening the life of the nation, we declare public health emergency like COVID-19. Thank you so much.
Thank you so much for your time. Appreciate that. Kevin, you're up. Go ahead. Gotcha. Rick. Yep. Rick. Thank you.
Does it get higher?
There you go. You can take it out if you need to.
Hi all, I'm Kevin Connolly from Dorchester. I live right behind South Bay. And I'm up here because, frankly, I am disgusted and appalled at the lack of empathy coming out of this room. I work on Mass and Cass, and I've looked in the eyes of a man as I told him his partner has died of endocarditis, an easily preventable disease. 2 minutes later, BPD was kneeling on his neck and arresting him for a trespass. He was in public. I've submitted empirical evidence to the council people. The evidence is very clear. Treatment first does not work. Housing first does. Go ask anyone on the street what's easier, kicking dope from indoors underneath a roof or kicking dope outside after being forced into a treatment facility and dropped on the road. Treatment first does nothing but bounce people around. I want to address some misconceptions that folks that are not from here don't know. HIV does not get transmitted through a needle stick. There are 0 cases of this happening. It sucks and is terrible. I don't like picking up needles and putting them in a sharps container, which everyone can do here. They will not kill you, but it does not happen. Secondly, trash in the area. Walk out a couple blocks down the street and show me a public trash can. They used to be there. They're now all gone. Put them back. Thirdly, why do people avoid the shelter system? People have looked me in the eye and talked about how their belongings are stolen, how they're beaten, and how they are raped. I want you to look a woman in the eye and tell her she belongs in a shelter, the same place she was raped. Listen to the people on the ground about what solutions work and have the courage to invest in them. City councilors with your $103,500 a year salary and Mayor Wu with your $207,000 salary do not understand what it's like on the ground. It is the poor, huddled masses that understand their conditions, and those masses alone. How can you possibly expect to find a solution while leaving out the most important group of people? In this room, we've got a lot of folks that think they're above the people, and that's criminal. Every working person is a couple paychecks away from sleeping rough. We need to center the people. An attack on the homeless is an attack on all working people. I have a proposal. Sorry.
You got about 15 more seconds, sir.
Sure. This is from a country that's tried to deal with this issue. Their law was, the purpose of this law is not retribution, but the protection of the community. Habitual criminals are to be regarded not simply as offenders who are to be punished again for their crimes, but as permanent dangers to society who must be removed from the national community in order to preserve it. This law, which mirrors the rhetoric of many of the people in this room, was passed in Nazi Germany in 1933.
Thanks,
Okay?
Kev.
If
Kev.
we as a city are starting
Kevin.
to mirror the rhetoric of the
Kevin.
Nazis, we need an
Kevin.
immediate dramatic change
Kevin.
in our direction.
Kevin, I got to ask you to respect other people's times as you've been allowed to come up here and speak because
I am
other people
urging
have
you, the city
respected the time.
council,
Thank you.
to not taint your legacy as council people with the blood of my neighbors.
Thank you very much.
Thanks all.
Appreciate it. Rick Winterson. Rick, I know we had called you up earlier. Thank you.
Good evening, everybody. Let me point out something. I don't want to repeat what anybody else has said, except I'm going to try to get somewhat negatively superlative about it. MassCast hasn't just failed. I believe, and I believe you believe, it has gotten much, much worse than it was during the encampment, which I covered for my newspaper. I knew it well. I'm in recovery myself. I knew people in MassCast who were tent dwellers, one of whom died. So I know what I'm talking about, and it has gotten worse. A symptom I see tonight, it's a complaint. When I finish, the people who have spoken for their neighborhoods, I live in South Boston on Dot Ave, will have spoken for about 55 minutes. All you people, elected officials and city employees, have spoken to each other for just over 2 hours. Thank you.
Thank you. Mr. DeRosa? That's it. Please, 2 minutes. Yep.
I don't even need the mic. I'm going to speak. You want me to use the mic? I stopped acting like Eminem, so I'm trying to.
Please leave things the way that the central staff has put them. Thank you. We just want, out of respect to them, please, thank you.
So, again, my name is Domingos DeRosa. I've been advocating for this since I was a baby. This is what I was born into, selling newspapers on this corner, because I actually did. That's not like fabricated. That's not something I pulled out of thin air. I actually sold newspapers on this corner. There was a mobile gas station on that corner for people that's been here longer than a week. I understand your frustration, because I'm a parent too. So when I first got in this room, I was you, sitting there pissed to tell my kid she can't go down a slide because somebody was just defecating on it. City had no maintenance schedule for Clifford Park. That's just a piece of what the frustration is from the kids for Orchard Gardens, who are watching people not only shoot up, but also, again, from her video, that clearly shows you masturbation is real. Because in that picture, it was more than just washing herself. I don't know what the mental status is for this person, but I've watched that at Clifford Park while young girls are playing softball. And BPD tells me this, first available unit, it's a call to priority. So the little black girls watching this white guy perform acts on himself is not priority? Then I don't know what is priority. And I got videos of that, of BPD circling these people, watching them have intercourse because they're told to stand down. And folks who've been here with me on the streets, causing traffic up and down Mass Ave, letting people know in Quincy that you're not going to get home on time because that's how much traffic we cause all the way to Somerville. With 10 people. We didn't have a mob. We had 10 concerned parents, neighbors, business owners, teachers, folks who coach like myself. I lost 300 plus kids who are gang affiliated because they put on the brick system because their fathers went to jail for selling the same drugs that I got a record for, that I use for my resume when it comes to talk about these dispensaries that they want me to sell drugs out of, but I couldn't get a license because I ain't got $500,000 because my family's on paycheck to paycheck. So excuse me if I don't have empathy for every single statement. I've heard it. They've heard it. Someone new to the panel. I give them that respect. But it's not new to the city. This has been going on for decades. Orchard Park is less than a mile away. They drop kilos of cocaine to my friends who I gangbanged with. As a junior, the feds, the same guns they give us. Do you really want to ask me those questions?
Thank
so
you.
I'm not here to talk to them because they could have emailed each other, to this gentleman's point. 2 hours of emails. Are you serious? Steve, you been here with us. Andy, you was in Quincy with me. And I got cussed out from the people in West Roxbury because I didn't go to their forum because Quincy was telling us as Boston, screw you and your goddamn EPA ruling. We're not letting you build mansions, so we build City Hall so the
Thank you,
unions can
Domingos.
get money. So I appreciate you guys coming out tonight. But September 9th is where you make your voice heard.
Thank you very much. Fernando Requena. Fernando, please make sure cell phones are silenced. Thank you. Fernando? Nope. Jessica Luzik? Is Jessica still with us? Nope. Bo Wang? Bo, you're up, sir. You have 2 minutes. Thank you. I got to go off the list here, man.
I want to thank. Hi, I want to thank Ed Flynn for actually proposing a good solution. I agree with what you said, and I really appreciate you advocating for us. And I'm not gonna talk about the poop on the steps or any of that BS because everybody deals with that, right? I think what we need to understand is there's a source of the drugs. We're talking about a Band-Aid on a huge wound. The drugs are coming from somewhere. I don't know, but hold on, don't interrupt me, please. The drugs are coming from somewhere. The drug dealers aren't getting picked up. I see this going on outside my house. The arrests are great, but who's prosecuting them? You can arrest all you want, but who's prosecuting them? Where's the DA at? Right? So I just want to say, I think everybody asked great questions. I support like all of our initiatives. I actually have more empathy towards the drug abusers after hearing some of the speeches. I was actually not empathetic, but now hearing like what you guys are experiencing and how you overcome it, I have more respect for you. But I think the issue is if you let these drug dealers with the shiesty on selling in front of people's homes, like it just it makes them more emboldened. And where I live currently, there is a drug house literally 2 doors down. I know for a fact because random people come in and out, and also they have shiesties on. And honestly, I'm going to move out of the city soon because of this. So I'm just saying this for the rest of us. But, like, we're getting scared walking outside. I have dogs, and I don't want them stepping on needles. And I'm just saying, like, you guys, maybe you don't want to come together as politicians and agree on something. But this, you should not think about party. You should think about where do we want the nation to be? Where do we want the kids to have a safe place? Forget about party. I think at this point, we need to step over that, come together, and focus on the end goal.
Thank you.
And if you guys hate Trump, whatever. It doesn't matter. You can have Santa Claus solve the issue. I don't care. You just need to come together and work with them. And we need the National Guard here. That's it.
Thank you, Ms. Mike. Appreciate it. Jessica Crownover. Jessica Crownover. Rich Napolitano. Rich. No, Rich left. John Stillwagon. Mrs. Stillwagon. I know he was standing over there earlier. There's a healthy. I'm going to say there's at least 25 more. No, I'm going through the names as folks signed up, guys. So is there a George? Is this a George Hanoi? I'm sorry. George H. Some ends with AOI. Nope. Steph Shapiro. Brian McCarter. Brian, you have 2 minutes, please.
Hey, thanks for letting me get my 2 minutes in here. I'm Brian. I live about a block from here. I've been attacked multiple occasions. I've had to use my hands to defend other people from harm, from people with weapons. Every single day there's 50 people outside using drugs, often with weapons, knives out, shivs. A couple times we've woken up to bullets out my front door, in the cars and in the back of behind my building. I'm just surprised I'm still alive at this point, living around here. And what's even worse just about the personal safety is you walk around and you see people with these like wounds on their body, like tranks eaten through their skin, like it's the size of like a large coffee cup, and you can see the sinews of the muscle underneath it. It's like rotting out. And so it's not safe for the people that live here. It's not safe for the people using drugs. We need a comprehensive treatment facility. The city is covering up the nature of the problem. I have requested data repeatedly from the city on the crime statistics to try to get raw data. I've asked it from Boston Public Health. The state has ordered 13 times to turn it over to me, and they won't give it to me. Dr. O's lawyers have gone as far as saying to ask the state to restrict my ability to ask for public records. I asked for the overdose statistics, and they wouldn't give them to me. I asked for the needle raw data, like purchase orders, to figure out like where are they going, where is it going? Just give me the data. No. And by the way, let's not that this guy asks for any more public records from us. It's getting ridiculous. The problem is bigger than the numbers say, and so I think we're all tired of hearing about these statistics because there are crimes that I know of. The gunshots in front of my door did not show up in the crime statistics. This situation is worse.
Thank you, Brian. Appreciate it. Heidi Brewster? Or John, can't read this, I apologize. P-E-I-N-Z-T-O, Painzot. Sorry, I apologize for the scribble.
That's all right. It's a tough name.
Yeah.
John Pagnato is the name.
Thank you.
South End resident for 8 years. I'm not going to share any personal stories. I think everybody's covered that. I just want us all to look ourselves in the mirror tonight and ask if we think that what we are experiencing is compassion. I think we lead with harm reduction, and we think that is compassionate. And I think there's a lot to be commended about what the doctor was talking about, a lot of those statistics. But is it compassionate to let people go on living that life, putting them on this conveyor belt back out onto the street, and the impact that that has on residents? And not for nothing, I've heard a number of stories about people looking to leave the city. My wife and I are considering the same thing. We have the privilege of that. A lot of our neighbors do not. A lot of our neighbors without means don't. And we know that impacts, black and brown people more than it does people who look like me. I just want all of you to understand what that legacy leaves for you all, what that leaves for Mayor Wu. I know she's very serious about DEI. This is going to tarnish that legacy for her and for all of you. That's it.
Thank you, sir. Janet Barrows? No Janet Barrows. So with that, folks, there is a second panel. However, it is going to be different from the first. So, we don't need the yawns just yet. But this is actually more of an organized community testimony as well. However, we have members of the civic presidents here. They're each just going to speak for about 3 minutes, right, as quick as you guys can. I will not be taking any questions. I don't think us as counselors will have questions for the civic group, but we more just want to hear from you guys. So, folks, as we go down the order, Steve, why don't we start with you? Just be careful moving the microphone. Thank you for turning the sun back on. And please just, guys, give your spiel, and then we'll get right back to public testimony.
Does this work? Yep.
Go ahead,
Good.
Steve.
So I'm Steve Fox. I chair the South End Forum. The South End Forum is the umbrella organization for all the neighborhood associations of the South End. I also chair the working group on addiction, recovery, and homelessness. We started the very first meeting in this room 10 years ago. We have been discussing this for 10 years, and this was the room where it all began. I'm going to be really, really fast because I could tell you war stories for the past 10 years, but all of you have them. The most important thing for me is to offer some potential solutions, and it's based on the past 10 years. I think, and I've said this over and over again to deaf ears, I think that what we need in order to address this as a real crisis, as a humanitarian crisis, and if we believe what all of the counselors have said to us, that they all treat it as a crisis, then we need to ask the mayor, the governor, representatives of the business community, representatives of the healthcare community, and nonprofits, all to come together and to figure this out. I don't mean that we simply assign a task force. I've been on all those task forces. I'm on one of those task forces now. But at the end of the day, all we do is make recommendations. And those recommendations over the past 10 years have not gone anywhere. I remember we created a 10-point plan, including let's eliminate having the needle exchange at Albany Street. Let's put it in community health centers. Let's move it to pharmacies. Let's decentralize it that way so that it's available to people where they need it. Nothing happened on that. Nothing happened on all 10 points. So my view is that the two things, I hope this doesn't turn you off, the two things we need are collaboration and leadership. And right now, I can tell you that, for example, the message that you all saw published about the city's efforts to try to address this crisis that just came out yesterday, nobody in the community was consulted about that. We didn't get a chance to contribute to that. So what's happened is that part of the reason things have gotten worse in the South End is because everybody who is sitting at the table has been excluded from the decision making. And we need to change that. And then we need to ask the governor and the mayor to really do the leadership thing and to say, I'm going to bring the people together that need to get brought together. We're going to figure it out, and we're going to figure the financing plan. To our counselors who say it's really a state issue, it is a state issue in the sense that we need the governor. But why is it that we can find $100 million for White Stadium, but we can't find the funds? We can't find the funds for a recovery campus. So there are questions about the priorities that we've made as a city that need to be questioned. And I just think it's time for us to concentrate on leadership and collaboration. And that's my solution based on 10 years.
Thank you, Steve.
Thank you, Steve. My name is Andy Brand. I've been a 27-year resident in the South End. I'm co-president of the Worcester Square Area Neighborhood Association. Boston's Mass and Cast current strategy prioritizes addiction management over recovery. Though it is well-intentioned, it has failed to solve the public health crisis on our streets. Residents and business navigate needles, human feces, people in distress every day. They endure burglaries, assaults, including one on a Boston Globe reporter, home invasions, stabbings, armed robberies, and now a shooting. The situation inflicts a human cost on children's innocence and everyone's safety and mental health. And this is per a report from the 2022 MGH report on health needs assessment. True compassion requires intervention. We need a strategy where recovery is the goal, not the exception. BPHC touted a 38% drop in overdose deaths, but that mirrors a 27% national drop and a 36% drop, Massachusetts decline. It was driven by naloxone and drug policy shifts, not by unique policies. Narcan saves lives, for sure. Over 23,000 doses distributed last year citywide, per the BPHC's own report. But resurrection doesn't mean recovery. Resuscitation doesn't mean recovery. On a Tuesday, a person saved on Tuesday is going to overdose on Wednesday without treatment. When I asked the BPHC worker for recovery options, I got an offer to get Narcan and a pamphlet telling me where to get needles, showers, and food. Only after pressing did I get a plain sheet of paper that had minimal information on CSS support services. No detox, no sober living, nothing, nothing but the bare minimum. BPHC claims low threshold housing success, but a 2024 Coordinated Response Team survey found that 83% of those in the open air drug market are housed. At a May 2025 South End Coffee Hour, Mayor Wu admitted that many of those housed individuals come here to use drugs. Now, this is not an individual failure. It's an ineffective policy that draws addiction to our streets. Recently, San Francisco implemented a recovery first shift through Prop 36 and Prop F with treatment mandates and enforcement. And this has led to very promising results and a 73% public approval rating per a July 2025 Chronicle poll. Now, Boston has a coordinated response team that shows similar promise to San Francisco, but on a small scale. There's a 7-person team, 7 people led by Kelly Young, that convinces 70% of the people with an addiction, when they encounter them, that their behavior is unacceptable and that they should get into treatment. And 70% do. They do this by offering immediate recovery options. I'm torn. A public health emergency under BPHC's current approach risks in entrenching failure. We certainly have a crisis, but what we really need to do is scale the CRT model by redirecting BPHC to a recovery first model and adding the following supports. Comprehensive inpatient recovery centers, where we build facilities that offer detox, root cause analysis, tailored treatment, job training, ongoing support, and even expungement. And also reform drug courts. We need to pair zero tolerance enforcement with treatment options, monitored recovery, or legal consequences. This is to guide people to help. Our recovery centers and drug courts will complement harm reduction. It ensures that the people battling addiction saved by Narcan today will avoid overdosing tomorrow. That's true compassion. Now, I'm torn because Dr. O mentioned that a formal declaration of an emergency would do is allow them to redirect resources. Well, one question: could you redirect the $200 million that one of the counselors said is being spent on White Stadium, and maybe redirect them to this? Another question that Dr. O asks is, where could we locate a campus? Senator Collins has a very credible ship proposal to put it on a ship that would meet all of the state's requirements, and because it would be on a ship, it would not face the same level of neighborhood opposition. So I'd like us to consider those two things as part of it, and I'll turn it over to Sue.
Hi, everyone. Thank you for your patience. And Councilor Fitzgerald, just give me the hook, okay? Because I am so incredibly passionate about this. A lot of you know me, Sue Sullivan. I have run the Newmarket Business District for the last 40 years and seen every iteration of everything come down the pike. And I will tell you that in 5 years ago and 10 years ago and all, people didn't realize how bad it was in Newmarket, okay? Because there were no residents. There were very few residents down there, okay? But we had 20,000 employees and 400 businesses, and we had the issues that we are dealing with today. And one thing we said all along is we did not want to just move it, okay? And unfortunately, that is what has happened. But let's be clear on what the issues are and how and all, because I am at ground zero, okay? We have had 170 people that we have taken from the street, and we've put them to work and all, and 75% of them are in recovery. And a lot of that has been with the work with the Boston Public Health Department and that they have paid for that workforce development, and those are all those yellow shirts, green shirts, the yellow vest guys you see on the streets, picking up close to 1,000 needles a day. So so there are initiatives that I think are really good. There are initiatives I don't agree with, and that is going to be the case of all of us. But here's the basic thing. There is no one answer. And what the issue is, and when I tell you, I was in those tents every day when we were moving them every day so we could clean the pile of trash out there 10 feet high. I wouldn't wish that on my worst enemy. Likewise, today, what we see on the street, the individuals out there, I also wouldn't wish on my worst enemy. Okay, and so it is incumbent upon us to help those who can't help themselves. But that means making really, really hard decisions overall. And so when we all talk about how we're going to solve this. And by the way, when, was it you, Bob? Yeah, Andy the other day, who said you couldn't get out of your house because there were 3 people shooting up and they couldn't get out of the way. And if you're a resident, I don't care if it's 2 people or 20 people, it's too many, okay? And so bottom line is, through the working group and Representative Moran, Councilor Fitzgerald, Kelly from the mayor's office, who am I missing? Steve, yes, okay. We are all working together with the state. I have to say, this is the first time I really feel like this. I shouldn't say it's the first time I feel like the state's been at the table, but I feel like it's the first time where we're all looking at this and saying, by the way, Steve and I, and we and Andy, we came up with the Recovery Campus, Recover Boston idea 2 years ago, whatever, okay? That is only part of the problem. But what we realized, and we found that out from public health and all, and got a lot of really strong partners together, is that there are gaps. We heard that all night tonight, right? There are gaps in the system. So that is a big piece of it. So one of the things we got to figure out is where it could go, who's going to pay for it. And by the way, there are partners out there like St. Francis House, Volunteers for America, Gavin House, who already do that long-term recovery model. They just don't have enough beds, and the beds don't have to be here. And that's why it is a regional and a state problem. But by the way, that's part of it. The other part of it is judicial initiatives. We've talked about this, right? Police, it's a fact that the police have made more and more arrests over the last several months, okay? But when they even have things where they're sectioning people and they have 26 people that need to be sectioned, but there are no attorneys, defense attorneys, so they get at the courts, so they have to let them back out and to do potential harm to themselves and others, okay? Then that's a problem. It's a problem that we got to look at having a comprehensive drug court, and also we have to look at the idea of, under that idea of helping people who can't help themselves, is what does, and I hate to say mandatory recovery, but you can't just let them keep doing what they're doing on the street if they're breaking the law, okay? And here's the thing, okay? It needs those wraparound services so when they do get into that recovery, they don't come right back out to the streets afterwards. They have to have the thing. And by the way, these aren't my ideas. These are so many collective ideas that we have been hearing, and we need to fix this now. And the other big piece is, I think we heard it earlier from the police and all, using resources differently, figuring out how they're going to put something here, something there, to solve so that you do not have people on your doorstep. And let me tell you, no one feels worse than I do that you do, and it's moved from Newmarket. A big part of the South End is still, a part of the South End is Newmarket, but I feel terrible about that, but I think we need to all work together. So, sorry, I went kind of long.
Nope. That was great, too. Thank you so much, and thank you for all you guys do as leaders in the neighborhood, presidents of civic groups, and other local organizations like Newmarket. I know you guys have been at this for a long time, since the beginning, and we will need to lean on your wisdom in the future as we create these solutions, and thank you for allowing all of us to be a part of that. Really should I allow one question? Go ahead. What's your question?
My question is, where does this resolution go from here, this hearing? Like, can you explain to us, like, what happens after all the stuff we've heard this evening?
Yeah. What I intend for this to do is for this to remain in committee, and then I think we want to have another hearing with some larger solutions around this, and then we can talk about, again, this resolution would be non-binding. So even if all 13 of us voted and said it should be a state of emergency or right, then it wouldn't have any teeth to it. But I'd rather get to the solutions, and if when we get to solutions, we propose the solutions to those folks, and then pressure what's going on. I'll take one more. I'll take two more, and then I want to make sure we allow.
Quick statement. I mean, to reiterate what the panel has said, we've brought these solutions, we created the solutions, we had conversations that, thousands. We had our first Zoom meeting, and Andy can attest.
What's the question, Domingos?
I'm making a statement. Because
You got your 2 minutes. I'm sorry. You have one question over here.
Okay, so the question is, right, so we keep hearing about adding more police, right? And we've had, again, what is the line item right now in overtime? Because when we first started this, it was at $2 million. And it's been increasing every year, few more, but we're at a point where I believe we're at like 7 million plus for police in the area that we watch that nobody can invest. So how is that money actually going to be put to real work moving forward? Because we're putting a budget line item on their overtime.
Gotcha. Thank you. Understand the question, Domingos. Yes. No. And that's something that we have to work. We're in this working group that we're on. BPD is at the table. The more we can work on the solutions, the less the overtime can come down. And we've got some more people coming on that we hope can stay within the area. But it is a longer term solution. I want one more question, and then I have to get back to the people who signed up first.
Thank you so much for hiring the homeless. I'm formerly homeless. I've been at Westmoreland. I've been throughout the state. You have no idea how many men and women you have helped off the streets. It doesn't matter how much you have paid them. In homeless shelters, every Thursday, homeless men and women have the opportunity to go to Mass and Cass and get a job. And we want to thank you for all the homeless men and women you have. Also, there's a homeless man here tonight. He just stated here tonight that he was homeless. If somebody in this room could reach out to him, and help him out. He just stated in front of everybody that he was homeless tonight. If somebody could reach out to that man. I've been there, I know we've all been there.
Thank you. Appreciate it. We'll now call up Bill Mutos. Is Bill here? Bill, come on up. Please, you have 2 minutes. We're going to have to move a little bit quicker, guys, as time is of the essence, but Bill, please, thank you.
I kind of see the need for a meeting like this and the other extremes that have been taken by people in the neighborhood and some of our counselors as, to me, a vote of no confidence in what this mayor in this city has done and failed at, her administration and any counselors that might be working for her and enabling her. So,
Let's keep going.
I've lived here 28 years, and it's never been this bad. Loitering, panhandling, breaking and entering, doing drugs in public, doing drugs period, drug dealing, shoplifting, public disturbances, public urination and defecation, vandalism, destruction of private property, theft. All of these things, when I was growing up, were considered crimes. They are no longer considered crimes in this neighborhood or apparently in this city. The population is not being held accountable, and they know it. And our community is suffering as the city has done nothing but the same failed strategy for years. I know it's more than just the mayor's office, but it starts there for this city if she really cares. Families are concerned for their children, seniors are at risk. People think twice about moving here when they see what is happening on some of our blocks. Businesses are closing. I'll skip that because we all know about Walgreens. We all know about the shoplifting there. Stores like 7-Eleven being besieged hourly by people looking to steal, harass workers, or worse. I feel badly for the owners and the workers. Who would want to work there? Why is the city, rather than supporting our vital local businesses, allowing this behavior to continue? Enabling addicts and letting the entire neighborhood become an open-air drug market just like Mass and Cass. We now have drug dealers in our neighborhood. I live right by Washington Manor, a BHA housing project intended for senior citizens and people with disabilities. In the last year alone, I've seen crowds around that building where none existed before. Young people on bikes with backpacks circling the neighborhood, stopping at that bus stop and other locations around the building. Why are people in their teens and 20s now hanging around suddenly a senior housing building? They're not there to visit grandpa. They are there to sell and buy drugs, and there are addicts living in that building now, and dealers as well.
Thanks, Paul.
Apparently, this became a low-threshold shelter, which was used to house addicts that were moved from Mass and Cass, and it's all gone unchecked.
Thank you.
Drug deals happen around that building 24/7, and we call 911, and the police damn well should be aware of that by now.
Thanks, Bill.
I talked to a Washington Manor resident who told me she herself is trying to stay clean and can't wait to get out of that environment. Yet those dealers and addicts are still living in that building, supplying drugs to those who come to our neighborhood to buy and use.
Thank you, sir.
Thank you.
Appreciate it. Noel Henderson. Maeve O'Donovan. Yep. Maeve, come on up. Paul Brines.
Thank you and good evening. Can you hear me?
Yep.
Thank you. My name is Noelle Henderson, and I've been a resident in the South End for 4 years now. I proudly live on Worcester Square. Beyond that, I also work in the South End as I'm a doctoral candidate at BU School of Public Health. I'm here as I'm deeply concerned as to the suggestion that the escalation that declaring a public health emergency may create, as well as commenting on the proposal of zero tolerance policy. Throughout the evening, I have heard multiple calls for creative solutions and people calling for us to think outside of the box. Well, I'm here proposing something that I have yet to hear tonight. I propose the creation of safe consumption sites. Supervised consumption sites provide a safe, clean space for people to bring their own drugs to use in the presence of trained staff. These sites have been proven effective in multiple ways throughout several cities, including New York City and Providence, Rhode Island. Firstly, there's never once been a death at a safe consumption site. If overdoses occur, people do not die because they receive a prompt response. Beyond that, and as to economic concerns, we know that when an individual overdoses at a safe consumption site, it is more cost effective to treat them there with either Narcan and sometimes just oxygen than it is to pay for the hospitalization and ambulance costs. Thirdly, there is no evidence of the honeypot effect, which is this argument that by providing these spaces, it will encourage additional drug use. In fact, we have not seen that at all. Yeah, we already have the drug use.
Yeah, hey, folks.
I actually said it at the beginning, so.
You've got about 20
and
seconds.
Basically.
Noel, sorry. Hey, stop.
So
Guys,
there is-
respect her time. You got about 20 seconds, Noel.
Sure, thank you. Okay, we need a solution. We do, and all of us are irritated, but I urge each of you to think very carefully if the declaration of a public health emergency is the answer. We have heard this evening that such declaration will not bring additional resources. We are all sick of the decrements in our quality of life. We all feel them. But there is a tremendous body of evidence that a public health approach is the solution to addressing the horrific disease that is addiction.
Thank you.
Thank you.
Appreciate it. Maeve. Go ahead, Maeve.
Hi, my name is Maeve O'Donovan, and I have 2 minutes. So I was really disappointed to hear this is only going to go to another meeting. But I want to put on record 2 things that have been mentioned a little bit, but I really want to bring back into focus. One is the sexual violence that's happening all over the place as a part of this. So we spent a lot of time talking about the addicts, but I think we need to talk about all the people, including people who are unhoused, who are being assaulted, and people who are on the street because they're coming home from work who are being assaulted, or people who are being coerced into the sex trade because they don't have any other opportunities in this city. We had a guy, this is not, and then the other is the physical violence and the lack of opportunities. We had a guy, so every night we hear people screaming and people saying the nastiest things at full volume, and I live across from a very large apartment complex full of children who play in that playground until like 11, 12 at night. They're hearing this every night. This is what they're being told by Boston is okay and is normal behavior. They're being told that using I guess I shouldn't use any of the words on record, but they're yelling this at each other as 12-year-olds and 8-year-olds because that's what they're hearing every day and nobody is stopping it. And the Boston Globe shows up and runs away. I understand why they ran away, but they didn't even run the article about what happened. So the physical violence threat from dealers is very real. It's one thing to talk about addicts, but there are no addicts without dealers. So we need to talk about that. But then hopefully I have time, the last thing I want to mention is psychological trauma. Look at this room and look at all the people who couldn't be here or who were here earlier. What is this doing to all of us and to all of you? What is this doing to our spirits, to our souls, to our compassion, to our empathy, to let this continue? Yes, I'm new to Boston, and I came from Baltimore, which everybody thinks is so horrible. It's actually a really cool city. And none of this was happening there, but it has other problems. But this is not good. People's hearts are being hardened on the daily, and it's not okay, and we really have to face that. Thank you.
Thank you, Maeve. Jennifer Shepard, Justine Gray. Oh, Paul's here. Oh, sorry, Paul. Didn't know it. Paul, you're up. And then Jennifer Shepard, Justine Gray, and Lauren Begley.
Thank you very much. I'll be very brief. My name is Paul Brinus. I live on Northampton Street off Harrison Ave, and I pick up a lot of needles and a lot of poop and a lot of vomit, and I'm very fortunate because I'm the husband of the woman who just spoke. And I only have one question, which is I can't understand why this city and other cities in the United States cannot stop the flow of drugs. I don't get it.
We're not here to answer it now, but
I understand that,
continue,
but
sir.
the cities have pretty powerful resources. I mean, that is, the drugs are out there. They're available. As you said, it makes money. So is the idea that that's going to continue?
That's it.
Oh,
Let's go.
okay. Good.
All set. Thank you so much, Paul.
Thank you for the edification.
Yeah. Thank you. Jennifer Shepard, Justine Gray, Lauren Begley. Paul. Hold on. Well, let me check the last page. I apologize if so. Oh, you just put Missy. Yes. Sorry, Missy. Thank you. No, yeah.
I just have some questions. First of all, I got to commend Sue, because I'm going to go a little bit more to that, the Section 35, but also Councilor Fitzgerald, Mr. Fitzy, sir, the fact that you spotted this as a regional crisis. I personally think we should have a wall between Dorchester and the South Shore, but I really appreciate you being so forward, solutions-minded about it. It's so let's talk about Section 35. Could the good counselors and the stakeholders, how much does an average Section 35 hospitalization cost? How much does it cost for the qualified petitioner to bring the person there, bring them through the judicial system? And something that Sue touched on was we're currently the public defenders, of which a defendant or a party of a civil commitment, they have the right to an attorney. So how are we looking out to make sure that people's rights are, respected through this process? This is the same city that unanimously the Supreme Court ruled that they violated the United States Constitution and let the group put the little flag up. So can we see the bills on that? Can we see for the trial officers? And then not only just Section 35, because people love that, I want to see Section 96 warrants when someone has scabies or someone has lice. How much money is going into this? How can we even say that we need to tighten the budget, but we have enough money to bring all these people through the court system? Councilor Vergero also said, harm reduction has got to be a part of the solution. Dr. Ojikutu's getting it. It's not really fair. And the harm reduction workers were out there protesting. That's the means. It's not supposed to be the end. But harm reduction, everybody remember mask? Do you remember seat belts? Do you know what I mean? Please, do you remember condoms? Do you remember, and third of all, I got to say this as somebody in recovery. Where was our harm reduction supplies when y'all were trying to ban NIPS when it comes to alcohol, the most widely abused recreational drug? Thank you.
Thank you very much, Missy. Appreciate that. Jennifer Shepard, Justine Gray, Lauren Begley. Nope. Michael Murphy. Philip Salt. Looks like a Patrick C-A-M-E-L, Patrick Connerty, Andrew Veriano. No. Do we have a Kate Luongo, Steve Jeffrey, Trevor Hill? Anybody? Mary Bowler, Ryan Miglionico. I know Al's left. Lou Rizzo, Kelsey Davis, John Bodica. Is there anyone that's signed up? Okay. All right. Folks, right? I'm just going through this thing. Folks, just get in the line, and we're going to just try and do 1 minute, because, hey,
how's everybody doing? My name's
Sir,
Clifton.
hey, thank you. One more second with directions.
Okay.
We're just going to have to do 1 minute each right now, because we are going to be up against the time with the hotel, and so I'm going to be very strict on this. It's 9:50 right now. Go ahead, sir.
Hello, everybody. My name's Clifton Braithwaite. Been working in the community for over 3 decades. We warned you over 20, 30 years ago about this epidemic coming. But when it was a white picket fence issue and everybody was hiding behind their money in the suburbs, no one paid attention when they arrested all my friends in my community. The issue of drugs is affecting everybody, but I'll end it right here. There's plenty of military bases where we can build property. I already checked it. I've been talking about it for 20 years. The solutions is just not in the council. It's the whole body, both parties, Democrat, Republican, and Independent, but most of all, us, the community, must force them by telling them on our voting time what we want to do. The solution is the Army bases outside of Boston where we can build and protect them. Remember, the white picket fence can be built again, y'all, but we got to do it collectively as a group of people. Thank you.
Thank you very much.
Good
Appreciate
job,
it.
councilors. Keep doing it, but work harder.
Thank you.
Good night, everyone. My name is Natalia. I live in the city of Dorchester. I also am a former employee of the Boston. I'm also a former employee of the Boston.
Is it? It's
You can hear me? Okay.
Yeah.
All right. So I'm also a former employee of the Boston Public Health Commission. I'm not coming here with any bad malice. I'm just coming here with my facts and my story working there. I was an outreach worker, and I can tell you that what the Boston Public Health Commission does is not right. Okay, it's more so a money's game. Okay, this is a numbers game that they're playing, because I myself would. Okay, let me tell you a story.
You have 1 minute. Just a reminder.
Okay, we had, under Marty Walsh's administration, we had the 10 out there. There was a safe injection site, okay? I can tell you that it does not work. You have the drug dealers that sit in the back, and they're known, okay? The employees, the management, they know that this is the drug dealer that's sitting back there with the mask on, and everybody will go there, congregate, buy their drugs, and they'll shoot up. Okay, while the employees are also ingesting these fumes from the smoking the coke. Okay, because I had to go to the hospital many a times for feeling woozy and overdosed. Okay. I can tell you that she does a good job covering up for the Boston Public Health Commission, because when the union puts out billables about what upper management is doing and how they are condoning these things, Bashula comes out and she says, oh, this is not true. It's not true. It's not true. It is true. If you really want to know the truth of what the Boston Public Health Commission is doing, my name is Natalia Bethel, and I'll be gladly to show you. I've taken evidence. I've taken things off the wall showing how they tell them to safely prostitute. I've never heard anything like that before in my life. You can safely this is called harm reduction. If you want to know the truth, I am here. I have facts, I have videos, and I have pictures of all the things that happen.
Thank you very much. I appreciate it. And again, folks, I apologize, but we do have a limit with the hotel here, so I'm trying to give everyone their time. Thank you. Go ahead.
Good evening. My name is Sharon Hinton. I'm an educator. I'm a parent. My mother. I'm a homeowner. And I'm also a candidate for District 5 City Council. We need a change. This is a drug society. We've always had drugs. People want to do drugs. And you have to be humanitarian. If anybody's had somebody in their family that's been drug addicted, you know what that does to not only the person, but to the family, the children, and generationally, what it does to the community. We have to have the will of the people on the ground. You cannot have people here who knows what's happening and you don't talk to them. It's an election season. We know what the politics are. We know what's happening. Pay attention to who is up here talking to you and what is being done. If these people have been doing it, Domingos DeRosa have been doing it for 10 years, but drugs have been in this country since the beginning. and it's always been against people of color. There's too much money being made. Go to the pharmaceutical companies. That's where you're going to get the money from to be able to fix this, because they're part of the problem. And you have to have the legislation. You have to empower the cops. When during the drug opioid thing, everybody went to jail. Didn't matter if you were using the bathroom in the place, everybody went to jail. And there were generations of people that went to jail that are still in jail. We need to enforce everything Malcolm said, by any means necessary. The communities, the businesses, the tax structure, the people that own businesses, the own homeowners, everybody needs to be at the table. I appreciate Ed Flynn and Councilor Flynn and Councilor Fitzgerald. You forced us to come to the table when the mayor said don't do anything until after the election. Keep telling the truth because we need a change. Thank you.
Thank you, Ms. Hinton. Thank you. Thank you.
Good evening. My name is Kimmer Manuti. I'm a resident of the South End here in Ruth Barkley, and I was blessed to be able to get housing through the Boston Public Housing Authority because I was also homeless. I had to flee Florida to find my primary care physician here in Massachusetts so I could get care due to medical racism and medical neglect. Now, that just tells you that the problem that we have in Boston isn't just a Boston problem. The whole country is falling apart. This is a top-down issue. You want to talk about drugs? We literally saw somebody on election day in a K-hole. We have decided that it's perfectly fine for people to do drugs as long as they have enough money and as long as they have enough power to get away with it. Coming here and saying that we need more police officers, that's not the problem. Calling this a state of emergency, that's not it either. Bringing more police in, you're harming people. How do we fix this problem? We deal with poverty. That's how we deal with it. We deal with housing. If these people had somewhere to go during the day, they wouldn't be shooting up in that lady's backyard or in this person's front yard. You kick people out of shelters at 6 a.m. The shelters are dangerous. I saw a lady die in a shelter, and then it got covered up. And I told the police, and then I told the Boston PD, and I told the Boston Globe. And guess what? Nobody gives a
Got you.
They killed
Thank
that
you.
lady and nobody cares. And then I watch people in the shelter from Catholic Charities steal from me. And then I call the police on them. And you know what they did to that lady? She's still working there, abusing people. So the problem in Boston and the problem in Massachusetts is that you have great ideas. You have shit implementation. You
Thank
guys
you.
do not know how to take someone from a safe place to a safe ending point. And that's why everyone is being harmed. Harm reduction means you take them from A to Z
Thank you.
safely.
Thank you very much.
How you doing? Joe Baker, Dorchester. I know a little bit about recovery. I've been in recovery a long time. There's an old saying, and it's, if nothing changes, nothing changes, right? So we all know that person, failure to launch, they're on their mother's couch till they're in their 40s, and they drink, and then the Nana gives them $20 a day, and the girlfriend always takes them back, and there's always a warm couch to crash on, and everyone, right? That's what the government is doing with these poor people. All right, I watched them. They walk into the drugstore, into the pharmacy here at BMC. They get their pills that we pay for. They walk out on the sidewalk. They're allowed to peddle those and trade them for street drugs, right? The police. It doesn't matter if they have a warrant. It doesn't matter if the drug dealers are all. The bottom line is nothing changes. Nothing changes, right? If we just took the laws that are already on the books, and we just use those for starters, right? Everyone says, well, they got to go in detox. Right. You don't go in detox when you're off empty every morning for free. You don't go in detox when your drug dealer's not getting chased. You go in detox when you're running around in circles and you're on empty, you got nothing, you have no money, you don't have a place to crash, you're cold, you're lonely, you're tired, then it starts looking good. Yeah. You don't do it if the police let you shoot up in their mirror of the truck, if the drug dealers get to do what they're, and it's not lost on me that the one person that could, with a swipe of a pen, start making a difference out here today is Michelle Wu, and she's not here.
Thank you.
It's not lost on me, right? It's ridiculous. Thanks so much.
Appreciate it. Thank you. Sam, go ahead. You have 1 minute. Thank you.
How you doing? My name is Samuel Pierce, and I want to thank Councilor Flynn and Councilor Fitzgerald for bringing this to the public hearing. First of all, I want to just remind everybody what we heard today, and that was that it costs $125 million. Now, if we do the math very quickly, times 10, that's $1 billion $225 million. Now, the reason why that's significant is because the bowling building costs $300 million. Now, we have schools that need to be replaced. We have sidewalks that need to be placed. And we're spending money on a solution that doesn't seem to be happening. Now, we were asking, what can the council do? Now, you all have laws. We all voted for you all. And so why are we not enforcing the laws that we have? I think that we have some great ideas. Maybe we can get some of the unions to actually take part and find out how many of these people would like a job. Building maybe the ship that ends up taking them wherever it's going to be. But I realize we can't fall into the definition of insanity, which is to keep doing the same thing expecting different results. Because in the 80s and 90s, you were locking up people that looked like me if they had a little bit of a joint. And now we have to basically be deprived of our pedestrian safety while people are literally shooting up, smoking crack in front of children in a school zone. And now we're sitting there thinking about allowing a $100 million stadium that will allow alcohol intoxication. So I feel like we're sending the wrong message. We need to say it is not okay to use drugs and alcohol on school property or in a school zone. Thank you very much for your time.
Appreciate it, Tim. Thank you. Rachel, go ahead. We get, again, 1 minute.
I'll try to be as quick as I can.
Please.
Can everyone hear me?
You're good. Just go.
All right. Thank you. So I am a candidate, an at-large candidate for the Boston City Council, respectfully. But I am here today as someone who lived around Methadone Mile for 9 years. And so my question is, where is our red line? Really, where is our red line? Because we keep on having these meetings, these hearings, and I am fully grateful to Councilor Flynn and Councilor Fitzgerald for forcing this issue, but we need to have solutions. In 2017, former District 7 Councilor Janey, and of course former Acting Mayor Janey, was forced to make a public announcement because one of her constituents took a video, shot a video of a couple openly fornicating, which it was shocking. It was absolutely outrageous. The following year, I myself had an issue where someone broke into the triple-decker that I was living in at the time in Dorchester. I had laryngitis. There was a couple, and fortunately they left without issue, but it could have been a very ugly incident. Let me be abundantly clear. I will always have empathy and compassion for those suffering with addiction, and I will always advocate for wraparound services for them to become healthy. I will always stand with the recovery community at every step in their recovery. But I think respectfully, we also have to start thinking about others who are affected by addiction. We have businesses, we have residents, and we have school children. And with our increasingly lax attitude and our, just...
Thank you, Rachel.
But I do have to say that human trafficking, we can't have that around our children. We have to have standards, we have to have accountability, and we have to have transparency. Thank you so much.
No, I appreciate it. I'm sorry I have to be so curt.
No.
Yep.
All right, hello. Thank you to everybody. My name is LaQueen Battle. I've been in Massachusetts for 6-7 years since the pandemic. I've been homeless in New York, Chicago, Los Angeles, San Francisco, as well as have family that have been on the streets. So I'm coming from the both end. I'm also running for city council in Cambridge, which I just received housing just 2 years ago. So thank you so much for your time today. Again, as you know, the main goal of being homeless is to get job assistance as well as housing. It's a blessing for women like Ms. Sullivan to get people off the streets and to get them employment. Anybody you know that's on the streets, that's their primary goal is to get housing, is to get jobs, and to take care of their families. Of course, the main goal here in any one of these social services with any kind of homeless person is family reunification. I'm gonna say that 3 times. Family reunification. Family reunification. Family reunification. Okay? Family reunification. Family reunification. Family reunification. Okay? Family reunification.
Thank you.
Thank you so much.
Thank you. I will just for the record, I will take there's only 2 people more in line. We'll take these as the last 2 folks, and then we're going to end the hearing.
Sean Nelson, D7 candidate. I'm going to be frank. I know for a fact that you counselors are ineffective and you do not deserve the money. You all should be voted out because none of you have the backbone to stand up to Michelle Wu because she helped in creating this problem. The same problem that goes on in New York, Chicago, California, Washington State. Imagine pasting and copy and paste. I know for a fact we need law and order and compassion because I know some of those people are down on their luck, others mental illness, others are selling drugs. I literally document it every single day. Needle team knows me by name. That's how bad it is. I've been assaulted 3 times. But when I reached out to you, for all of you, not one of you got back. If you did talk to me, you gave me lip service. They can sit there and shoot up in public and it's been recorded. But yet let me open my mouth to the mayor and I get arrested and have 9 cops surround me. Not one of you have done anything. I already know most of you on this end, you're in Michelle Wu's back pocket, her little pets, canceling meetings. That's why it's not. You don't need the money. You need to be effective, okay? It's disgusting that I have to help pick up needles.
Thank you.
Time for change. And you guys do not do anything because no one holds you accountable.
Thank you, John.
Simple
Thank
as
you.
that. All of you are two-faced and need to go. And everyone knows this is
Thank
an
you.
election year. If they're not going to go do their jobs, replace them. If this was an actual private business,
Thank you, sir.
they will all be fired by now.
Thank you.
You all need to have pay cuts too.
Appreciate it.
You need to fix this city.
Mr. Alves?
I'll be quick. So Jonathan Alves, 10-year resident of the South End. I know pretty much everybody up here. All I'm going to say, just for the record, is that the conditions at Mass and Cass and beyond remain inhumane and out of control for everybody. That's the people suffering, that's the businesses, and that's the residents. I'm the father of a 19-month-old daughter now. I've been on the forefront of this issue for 10 years, so I have even more of a vested interest to be in this community and help support in any way I can. What I would like to propose for the council is really 3 things. The first is to continue with an overwhelming police presence and give them the resources that they need. And also Kelly Young's team on the outreach. Give them the resources. If they need people, they need people. If they need money, they need money. The second thing is for this council to really seriously adopt community-driven plans led by Steve Fox and Andy Brand and many others that are here, like Recover Boston. These are good ideas. These are detailed plans. And then the third, I think Steve said it or somebody said it earlier, maybe it was John, Rep. Moran, collaboration. So there's a lot of city councils here tonight, which is nice to see, but not everybody's here. So we need collaboration from the city council. We need collaboration from the MBTA and their police organization. We need collaboration from the state police and the governor's office. That's all I'll say. Appreciate everybody's time, and let's keep fighting the fight.
Thank you, Jonathan. So I'll say this, folks, it's 10:07. We do have to be out of the hotel. I appreciate all of you that stayed here. This is not the end of the conversation. We will take everything we heard tonight. We'll go to the administration. We'll work on solutions and plan on our future hearings to bring those solutions forth to you all. But thank you so much. You don't know understand how much it means to have been here and testified. Thank you all. So with that, this hearing on docket 1457 is adjourned.